I think we are live now. I think we are live now. Okay. You to this sound. I think we are live now. Okay. You to this sound. Okay. You to this sound. I want to see. I want to see. Okay. Hello friends, good evening. Dr. Dhawan here, your ENT faculty. Is the sound okay? Is the audio video okay? Please confirm. Is the audio video okay? Good evening everyone. Good evening. Thank you very much. Yeah, it's going to be here on YouTube. Don't worry. Don't worry. Just focus on learning. Don't worry. Video rahega. Video rahega. Don't worry about it. We will not delete this video. Do not worry about anything. Just let us be together for 2 hours to revise important points of ENT. And about anatomy video, it will be uploaded soon. Yesterday's video will be uploaded soon. Do not worry about that. The team is already working on it. It was a makeshift arrangement made because of the app issue something, but it will be uploaded soon. Do not worry about it. Okay. Yeah, it's audible and it's visible also. So guys, welcome everyone, and my dear FMGs, this is Dr. Rajiv Dhawan, your ENT faculty, and we are going to be here together for 2 hours to revise the important points of ENT. So what I require from you, your 100% focus right now. Forget everything, forget every other thing out of your brain, and focus on these questions and concepts and images so that you are able to revise the important points of ENT one more time before 4th June comes over there. Okay, fine. So let us start now, everybody. The first question, everyone. Parvez, belonging to a family of traditional classical musicians, has been playing the instrument shown in the picture. He has lately developed a neck swelling on the right side. What is the possible diagnosis? So this guy's name is Parvez. It's a family of musicians, and this instrument, if you see over here, is a trumpet. It's a trumpet. And you know which disease is common in trumpet blowers? The trumpet blowers are prone to develop laryngocele. You know laryngocele. Laryngocele is what? Laryngocele is abnormally dilated saccule. With one question we revise other question also. The trumpet blower would be having chance of developing laryngocele. What is laryngocele? It's abnormally dilated saccule. One more question. Laryngocele pierces which membrane to come out? Laryngocele pierces thyroid membrane to come out. So what is laryngocele? It is a large saccule. It pierces which membrane to come out? Thyroid membrane. Second question. It is air-filled swelling. When you press it, the air sound can be heard. The leakage sound of the air can be heard. This is called Bryce's sign, everybody. Bryce's sign. Very good. Trumpet blower, my dear friend, you are clinicians actually. There was no clue of the classical question. He just gave a trumpet and you know it's laryngocele, beta. Okay. So Bryce's sign means when you press it, the air leak sound can be heard. And X-ray neck with Valsalva. You know Valsalva, everybody? Valsalva. X-ray neck with Valsalva. What is Valsalva? Look at me. Like this. When you do like Valsalva, the swelling become more prominent. So X-ray neck with Valsalva is only used for laryngocele in ENT, beta. So please look at the main clues in the question. Do not dissect the question. X-ray neck with Valsalva. So this is a question of laryngocele, beta. Now next question, everybody, this is a rapid fire session. Let all cells of your cerebrum be available for the revision, beta. Which of the following is the feature of acoustic neuroma? Acoustic neuroma, which of the following is a sign? Reservoir sign, Grissinger sign, rising sun sign, or Hitzelberger sign? The answer is Hitzelberger sign, beta. What is Hitzelberger sign? Hitzelberger sign is loss of sensation in posterior superior part of EAC. Posterior superior part of EAC. Loss of sensation in posterior superior part of EAC. Hitzelberger sign is a classical feature of a carcinoma. Reservoir sign is a feature of acute mastoiditis. Okay, reservoir sign. When you clean the pus, more pus comes. Reservoir sign, acute mastoiditis feature. Sometimes it is also seen in suppurative stage of ASOM. But classically, reservoir sign and lighthouse sign. Reservoir sign, lighthouse sign. These two are classical feature of mastoiditis actually. Okay. Grissinger sign, very important MCI question. Grissinger sign is what? Grissinger sign is pitting edema on mastoid. Everybody, can you tell me in which disease you see Grissinger sign? Pitting edema on mastoid. Grissinger sign is a feature of sigmoid sinus thrombosis. Everybody, do not forget Grissinger sign. Grissinger sign is a pitting edema on the mastoid. It is a feature of sigmoid sinus thrombosis, beta. And ultra classical question, rising sun sign. Rising sun is red in color, beta. Red in color. It is seen in vascular tumor called glomus jugulare, beta. Guys, did you notice one thing? One question, 4 question revision, beta. One question, 4 question revision. One more time, beta. Hitzelberger sign, acoustic neuroma. Rising sun sign, glomus jugulare. Lighthouse sign, reservoir sign, acute mastoiditis. And Grissinger sign, very importantly, likely question this time. Grissinger sign is a feature of sigmoid sinus thrombosis. It is pitting edema on the mastoid. Pitting edema on the mastoid, beta. Okay, which are fine. Everybody, let us go for everybody leave everything, beta. Leave the chat box, be with me. In between when I ask question, only go over there. Forget about the video will be available after the class. I want your every hour is precious, beta. May you all pass. The only heartfelt wish, only thought behind these sessions is, may you all pass, beta. May you all pass. And if this can contribute even minimally to your, possibility of passing, I would be happiest person on the planet actually. That's what I'm trying to do. I want your mental availability. Please fully be available over here. Let us revise certain things. Which muscle is responsible for opening the glottis, beta? Now I have twisted the question. Opening the glottis, look at my hand, but glottis means vocal cord. Opening means what? Abduction or adduction? Abduction or adduction? Opening means abduction, very good. Abduction, beta. The only abductor of vocal cord is posterior cricoarytenoid, beta. This is the only abductor of the vocal cord. Less 3 are adductors, beta. Adductors, lateral cricoarytenoid, interarytenoid, cricothyroid. Very famous question of MCA paper is the only abductor of vocal cord is posterior cricoarytenoid, and I have changed the question to which muscle is responsible for opening the glottis. Now you tell me, everyone, please look at this question. Will you be able to handle this kind of change in the paper? You read in the notes abductor of vocal cord. I asked opening the glottis, beta. Can you handle this much change in the paper? Yes or no? Answer me. Yes or no? Are you going to expect every word written in your notes should be asked the same way? Is that the expectation? Let me set the expectation right now. That paper will be out of your notes, but the language will belong to the examiner, beta. Are you able to handle this kind of change in the exam or not? Or you want it to be abductor only, beta? I trust you guys. You have got a brilliant common sense and you have got a very sharp brain. That's why you are here and that's why you survived in the foreign land also. So trust your common sense, beta. Trust your common sense. You will be able to handle this kind of change. Only thing is, don't be too rigid about words and all. Go for the common sense and essence of the question, beta. Okay, fine, wonderful. Everybody, now, last session question also. A child presents with history of foreign body ingestion. The X-ray picture is given in the image. What is the possible site of foreign body infection? This was asked the last time also. So this is the X-ray neck lateral view, beta. X-ray neck lateral view. Is this in the trachea or is it in the esophagus, beta? Because please look at me. The trachea is here after the esophagus. Look at me. Trachea, esophagus and then vertebra. Now how to handle this question? Let me help it out for you. Look at the cut section of your neck, beta. From anterior to posterior, first comes the trachea and then comes the esophagus, beta. Trachea and esophagus. Everybody please see the widest diameter of trachea. the widest diameter of trachea is in the antero-posterior plane, but the widest diameter of esophagus in the side-to-side plane, beta. The widest diameter means possibility of passing the foreign body along this route, beta. The widest diameter of a trachea is antero-posterior, but esophagus diameter is side-to-side, beta. Okay? So I have designed a very special, I can say, the piggy bank for you, and this is a greedy piggy bank, beta. It's a greedy piggy bank. It has got two holes. The front hole, this one is for the trachea, and the back hole is for the esophagus, beta. Just to make your life easy, trachea has got antero-posterior diameter, and esophagus got side-to-side diameter, beta. Okay, side-to-side diameter. Okay, fine. Now, if you have to pass a coin into this, beta, first of all, let us pass the coin in the esophagus or trachea. Let us pass the coin first of all in the trachea, beta, in the esophagus. This is the esophagus. The back hole is the esophagus, beta. The back hole is the esophagus. Okay, fine. Now, please see, if the coin goes in this one, what will happen is that, look at everyone. Right now, the coin is passing through esophagus. Esophagus, beta. Esophagus. This echo here. Esophagus. 1 second, we're checking the sound, beta. We're checking the sound. 1 second. Yeah, we're checking the sound. Don't worry. Yeah, we're checking the sound. Is the audio fine now? Is the audio fine? Now okay? Everybody confirm please. Is the audio okay? Audio okay now? Okay now. Very good. Very good. Okay, fine. So guys, please see on the screen. Now this coin is passing through the esophagus. Okay. Now, if you take the X-ray from front view, antero-posterior view of the X-ray, if the foreign body is passing through esophagus, in this position of the coin, if you do the front X-ray, front antero-posterior view, you will be able to see the full coin on the X-ray, beta. So this is antero-posterior view or the front view of the X-ray, beta. But from the side view, beta, look at screen, beta. If you look at from side, the lateral view will show only the edge of the coin, beta. The lateral view, the side view, will only show you the edge of the coin. If the foreign body is in esophagus, the front view, the antero-posterior view will show the full coin on the X-ray, but the lateral view, the side view will show only the edge of the coin. Okay? Now, let us put the coin in the trachea, beta. And I hope you remember, the widest diameter of trachea is antero-posterior. So when the foreign body goes into the trachea, now imagine if you take the front view. If you take the front view, beta, what will happen? If you take the front view, will you see the full coin or the edge of the coin? Yes, you will see the edge of the coin, beta, because right now the foreign body is like this, beta, like this. Okay. Now please see, if the coin is in trachea, then on the front view or the antero-posterior view, you will see the edge of the coin. But on the lateral view, beta, please look at screen, beta. If you see the lateral view from here, from lateral view you will see the full coin, beta. The side view, you will see the full coin, beta. Full coin. Please try to understand. If the foreign body is in esophagus, from the front view you will see the full coin, beta. Let me make it easier for you to remember for the upcoming examination also, beta. Look at screen, beta. How to remember? Write down 3F. 3F, beta. First F. If you see the full coin on front X-ray. Front X-ray means antero-posterior view. Okay. Okay, fine. Now then, the foreign body or coin is in the food pipe, beta. Food pipe means esophagus, beta. Everybody, okay, take a screenshot for this and remember this, beta. F, beta. If the full view of the coin is seen on the front X-ray view, which is the antero-posterior view, then it means that the coin is in the food pipe, beta. Food pipe means esophagus. F, front full view of the coin. F, front X-ray, antero-posterior X-ray. Food pipe means esophagus, beta. Now you tell me, beta, Is this not easy to remember now? F, F, F. Full view of the coin on the front X-ray means the foreign body is in the food pipe, means esophagus, beta. Rest everything is reverse of this. Don't forget F, F, F. Is it easier now, beta? Is it easier? Will you remember this greedy? Okay, fine, beta, fine. Very good. Wonderful. Let's go further, beta. Everyone. Now let us go further. Wonderful. Lakshmi, 26-year-old lady, has bilateral hearing loss, which is progressively increasing in severity for last 4 years. Beta. Now everyone, focus the screen right now and please see Lakshmi, young lady, young female with bilateral hearing loss, which is progressively increasing in severity for last 4 years. She also says that her hearing is better in noisy area. Her hearing is better in noisy area. What is this called? This is called paracusis willisii. Paracusis willisii. My dear friends, you are absolutely right. This is a patient of otosclerosis, beta. And otosclerosis has got AS curve, beta. Otosclerosis has got AS curve. I'm 100% sure that you guys know. A young lady with bilateral, gradually progressive hearing loss with paracusis willisii. Nobody will forget paracusis willisii. It's a feature of otosclerosis. Paracusis willisii means patient hear better in noisy area and the impedance audiometry curve or tympanometry curve is AS tympanogram, beta. AS tympanogram. Very good. Such an intelligent crowd, beta. I'm amazed. You are clinically oriented to the subject. Wonderful. Now type B curve, beta. Flat curve is seen in flat curve is seen in glue ear. Very possible question again, and nobody will forget glue ear is also called a serous otitis media. Nobody will forget this one, beta. Glue ear will be asked in your paper as serous otitis media, beta. Glue ear is synonymous with serous otitis media, and glue ear will give flat tympanogram, which is called type B tympanogram, my dear friends. Type B. Everybody, audio is okay. Everybody, audio is okay. Audio is okay now. Everybody, very good. So type B tympanogram or the flat tympanogram is seen in glue ear, and I will remember always that glue ear is also called serous otitis media. Okay, fine. Now, next question. Again, I have tried to cover all the question asked in the previous 5-6 papers, beta, in this session only. Pulsatile tinnitus with bleeding polypoidal red mass in the external auditory canal for female patient is typically seen in, I told you n number of times in the class also, that a female patient with something pulsating or bleeding in the ear is glomus tumor, beta. And look at the choices. Oh, glomus tympanicum, a cocinuroma, Meniere disease, angiofibroma. And you know, some people say, oh, मेरे notes में तो glomus jugular लिखा हुआ है. Glomus tympanicum तो पता नहीं क्या होता है. I don't know what is glomus tympanicum. I have read glomus jugular. There is glomus now. There is glomus now. Go with the common sense, beta. Believe me, if you will not be too radical, you know, evaluation of the paper questions, you will be easy, you will be having correct answer over there. Sometimes we change the answer from C to D, thinking a rare thing would. Glomus, hai na? And if you remember your notes, have got this line. Glomus jugular, the last line was, if the similar tumor arises from the middle ear, it's called glomus tympanicum, beta. Okay, so this is glomus. None of you will forget this thing, beta. Glomus is of two types, glomus jugular and glomus tympanicum, beta. Very good, glomus tympanicum. Okay, fine. Fine, beta, fine. Now, please look at me, beta, everyone. Look at me. Guys, ENT has two vascular tumors. One in female, one in males, beta. Let me solve two MCQ the MCI for you. A lady with something pulsating or bleeding in the ear is glomus question. A young boy with epistaxis is angiofibroma question. I may repeat two straightforward question of the MCA paper. There are two vascular tumors in the ENT, one in female, one in males. A lady with something pulsating or bleeding in the ear is glomus question. A young boy with nasal bleeding is angiofibroma question. 100% sure short diagnosis. Angiofibroma is also called a juvenile nasopharyngeal angiofibroma. Why we say juvenile? Because it is seen in young boys, beta. So this patient, pulsatile tinnitus, beta. Pulsatile tinnitus is not seen in any other tumor, beta, except for glomus jugular, beta. Okay, and it is more common in females. The answer is glomus tympanicum or glomus jugular, beta. Am I clear? Very good. Now, 33-year-old male patient is suffering from, everybody read it question with me. 33-year-old male patient suffering from recurrent vertigo, hearing loss and tinnitus. Guys, whenever you get a recurrent vertigo, hearing loss, tinnitus, three symptoms, beta. together episode comes. The episode finishes within few hours. What is the possible diagnosis? It is a Meniere's disease, beta. Meniere's disease has a triad of symptom in the episode. It is tinnitus, vertigo, hearing loss, beta. Tinnitus, vertigo, hearing loss. Am I clear, beta? Tinnitus, vertigo, hearing loss. Why it is not BPPV? Guys, BPPV vertigo is only for few seconds. And very importantly, BPPV does not have any other symptom apart from vertigo. BPPV, benign paroxysmal positional vertigo, has got no other symptom apart from vertigo, but Meniere's has got a triad of symptom in an episodic manner. Triad has got tinnitus, vertigo, hearing loss, beta. And that symptoms last for 24 hours, beta. Less than 24 hours, but BPPV episode lasts for few seconds only, beta. Few seconds. Okay, the answer to this question is B, Meniere's disease. Very good. Wonderful, guys. Wonderful. Okay, very nice. Everyone, which tuning fork test is specifically used to diagnose otosclerosis? Specifically, nobody forget Gillies test, beta. And plus one more test, Bing test. This is 2016 question of your paper, FMGE ENT. Gillies test was used to diagnose which disease? Otosclerosis. And my dear friends, Bing test also. Gillies test and Bing test are particularly used tuning fork test for the otosclerosis, beta. BPPV, Sushma, is more common in female. You are right. BPPV is more common in female, Sushma. It's more in your gender. I'm sorry for that. BPPV is more common in females, beta. Okay. Everyone focus in the class, beta. Yes, we are uploading the anatomy video. Have just patience. We are working on that. Do not worry. Everybody is with you. Do not worry about it. Each one of us wants that you should pass the exam, beta. So have faith. Have patience. The video will be uploaded. Let us revise the ENT right now. Okay, we are working on that. Do not worry. Which of the following would be the most appropriate treatment for hearing rehabilitation of a patient of neurofibroma type 2, guys? Let me tell you, neurofibroma type 2 has got bilateral acoustic neuroma, and nobody will forget this thing. Acoustic neuroma is also called as vestibular schwannoma. Don't change the answer because, oh, new word. Acoustic neuroma is same as vestibular schwannoma and 8th nerve gone wrong. Both 8th nerve got tumor both side, beta. And I hope you remember, what is the precondition of cochlear implant surgery? Cochlear implant, the precondition is normal 8th nerve. Never use cochlear implant if 8th nerve is not normal, beta. If 8th nerve is not normal. In this case, 8th nerve both have got problem, both have got tumor. So this patient will go for brain stem implant, also called as auditory brainstem implant. Beta. Auditory brainstem implant. Once again, acoustic neuroma is also called as vestibular schwannoma. Glue ear is also called as serous otitis media for your paper, beta. Neurofibroma type 2 has got a special property. It has got bilateral vestibular schwannoma, means both 8th nerve gone abnormal. My prerequisite of cochlear implant surgery is normal 8th nerve. So in this case, cochlear implant is useless and we have to go for auditory brainstem implant, ABI. Very good, ABI, beta. So the only indication of ABI for you is neurofibroma type 2, beta. Okay, fine. Everybody now focus on the screen. Let me ask you a clinical question. 23-year-old female patient has been diagnosed to be a case of otosclerosis. Otosclerosis is common in young females, correct? Okay. Otosclerosis shows pinkish appearance behind tympanic membrane. My dear friends, focus on this. Pinkish appearance behind tympanic membrane. Pinkish appearance behind tympanic membrane. And this is called Schwartz sign, beta. This is called Schwartz sign. This is called Schwartz sign. And I hope you remember Schwartz sign is seen in early stage of disease. In this case, you always go for sodium fluoride, beta. I hope you remember we said that if Schwartz sign is positive, we go for sodium fluoride therapy. The treatment of choice of Schwartz sign positive patient is sodium fluoride. The kind of answer I'm getting in the chat box are amazing. That shows that your concepts are so clear. Wonderful. You don't now, FMGs are not dependent on that Schwartz sign positive treatment of choices. Not like that. Now you can interpret that, oh, tympanic membrane, having pinkish appearance, then you should be having Schwartz sign positive. It means that I will go for sodium fluoride therapy. Otherwise, the treatment is surgery, beta. The surgery. And the best surgery is stapedectomy. The best surgical name is stapedectomy, otherwise stapedectomy. Stapedectomy or stapedectomy, beta. Stapedectomy or stapedectomy, beta. Am I clear? Right? Fine. Okay? Fine. Everybody, 60-year-old male patient with uncontrolled diabetes, presenting with severe pain in the ear and facial palsy. You remember old diabetic ear patient, beta. Old diabetic ear question. What is this? Malignant otitis externa. Old diabetic, controlled, uncontrolled, I don't care. Controlled, uncontrolled, I don't care, beta. Fine. Uncontrolled diabetes or controlled diabetes, my notes doesn't say anything, no problem. 80% of the language should be meaning sense to you in medicine, in surgery, in OBGY, wherever you are, beta. 80% of language should conform to the concept you have made out of your notes, it's okay. 1-2 extra words should not make you change the answer, beta. Okay, have you seen when you change the answer too much, it goes wrong, beta. Okay, old diabetic ear question is malignant otitis externa. What is the causative organism? Pseudomonas aeruginosa, beta. Pseudomonas aeruginosa. Pseudomonas aeruginosa. Very good. Malignant otitis externa is called by Pseudomonas aeruginosa. Perfect answer, beta. Wonderful. And the drug of choice is third generation cephalosporin. Pseudomonas, beta. Third generation cephalosporin, beta. Okay, very good. Guys, let me remind you, ENT has 2 questions in diabetes, beta. Young diabetic nose question, mucormycosis. Old diabetic ear question, malignant otitis externa. You say, Rajiv, what are you trying to tell us? I'm trying to tell you hacks, beta. Because every question will not be having too much time to dissect. Oh, old diabetic ear question, malignant otitis externa. Young diabetics nose question, mucormycosis, beta. Let us otherwise read the whole body of the question. Major sense is mucormycosis. Young diabetic nose question, black mass in the nose, mucormycosis, beta. Old diabetic ear question is 100% malignant otitis externa. Caused by Pseudomonas aeruginosa. And drug of choice is the third generation cephalosporin. Now, next question, everybody. In which disease the given prosthesis is surgically placed in tympanic membrane? What is this, beta? This is grommet. What is this, beta? This is grommet, beta. This is grommet. Grommet. And I hope remember, I always tell in the class, G for grommet and G for glue ear, beta. G for grommet and G for glue ear. Glue ear, beta. G for grommet and G for glue ear. Glue ear, beta. Okay, fine. So it is serous otitis media, also called as glue ear, beta. Also called as glue ear. Am I clear? Glue ear. Glomus, G for grommet, G for glue ear. Grommet is required for glue ear, and glue ear is also called serous otitis media. Right now, the picture in front of you is grommet, and grommet is also always used in glue ear. And the other name nobody will forget is the other name nobody forget will be the other name of glue ear is serous otitis media. Serous otitis media. Okay, fine. Now, next question. 35-year-old, everybody, are you in sync with me? Are you in sync with me? I hope it is a rapid review for you guys and you are in sync with the class. You are actually trying to absorb each and every point being said about each and every question and the relevant choices also. Are you in sync with me? Is this data going ahead or not? My utmost wish is that these 2 hours should be, super productive hour for you. Not reproductive, but productive hours for you. Okay, fine. Do not worry, good times are coming to you. On 4th of June evening, you will be a different animal, I'm sure. We all different animals on 4th of June. Till that time, hold your horses. Let us revise. Okay, fine. Very good. Okay, fine. Display clear करने के लिए बोल रहे हैं. Okay, fine. 35-year-old lady, while cleaning her ear with a hairpin, accidentally damaged her ear. What is the best management of traumatic ear perforation? What is the answer? Traumatic perforation of the eardrum, we always go for the no treatment required. Conservative treatment. Conservative treatment. The treatment is conservative treatment. I'm clear, beta? So treatment is conservative treatment. No treatment required. Do not put any ear drop, beta. Do not put any ear. No ear drop, beta. Do not put any ear drop, beta. Do not put any ear drop. No ear drop should be put. No surgery, no antibiotic, no nothing, beta. Okay, conservative treatment. All traumatic perforation, the primary treatment is the conservative treatment, just to keep the ear dry, beta. Just keep the ear dry. Okay, fine. Now, let's go further, beta. Otoliths are concerned with the which function of the inner ear, beta. Otoliths are concerned with the which function of inner ear. I hope you remember, everyone. Otoliths. One second. See, this is your cochlea, utricle, saccule, and semicircular canal, beta. Okay, fine. Now, this is your. One second. This is your utricle and this is your saccule beta. Utricle and saccule. Now please look at me, beta. Actually, otoliths are the calcium carbonate crystals in the gelatinous layer of macula. What is macula? Macula is the sensory end organ of utricle and saccule. And utricle saccule are linked with the linear balance beta. They are linked with the linear balance. So the answer to this question is linear balance beta. The answer is linear balance beta. Linear balance. Okay. Once again, can we see this pen? Linear balance beta. 1 second beta. 1 second, hold on. You want to switch on the camera? Hello, hello, hello. Okay. Can you check the thing? So guys, let us repeat this question. Otoliths are concerned with the which function of inner ear beta? What is otolith? Otolith is also called otoconia. Otoconia, everybody please see. Fine. This is your cochlea, utricle, saccule and semicircular canal. Now please see, this is your saccule and this is your utricle and cochlea over there. Okay, fine. Now, please see, in the saccule and utricle, we have got macula. So macula, this red thing is macula. Macula is the sensory end organ of utricle and saccule, and macula is covered by a gelatinous layer. Macula is covered by gelatinous layer, which has got calcium carbonate crystals called otoconia or otolith. Otolith beta. Okay, fine. Fine beta, fine. Okay. Now otoconia or otolith, then it is concerned with which function inner ear? Utricle, saccule are linked to linear balance beta. Linear balance. Please do remember, utricle, saccule are also called as otolithic organs beta. Otolithic organs. The otolith is a famous question source of the FMGE examination. Let us once again revise. Macula is the sensory end organ of utricle and saccule, and utricle, saccule, they are meant for linear balance. Macula is covered by gelatinous layer which has got calcium carbonate crystals which are called otoliths or otoconia. So otolith or otoconia are concerned with the linear balance of the body. Okay, that's why utricle, saccule are also called as otolithic organs. Otolithic organs. Okay, fine. Chalo. Now, interpret the audiogram given in the picture and comment on the most probable diagnosis. Everybody please see on the screen. Now please see, this is your audiogram. This is bone conduction curve, 2000 Hz shows a dip, and this is of course Carhart's notch. Everybody you know Carhart's notch? Carhart's notch is a feature of otosclerosis. So Carhart's notch is a dip at 2000 Hz in bone conduction curve, and this is a feature of otosclerosis. Carhart's notch is a feature of otosclerosis, and Carhart's notch is a dip at 2000 Hz in bone conduction curve, and this is a feature of otosclerosis. Okay, fine, very good. Let us revise other things also. Please see, dip at 4000 Hz in ACBC is a feature of noise-induced hearing loss, and this is called acoustic dip. Let us revise the 4 question of the audiology beta. Dip at 2000 Hz in BC is this question Carhart's notch, and Carhart's notch is a feature of otosclerosis. Otosclerosis. Okay, and then comes the rising audiogram beta. Rising audiogram would be a feature of Meniere's disease beta. Rising audiogram feature of Meniere's disease, and sloping audiogram is a feature of presbyacusis. Presbyacusis is age-related hearing loss. Presbyacusis is age-related hearing loss. Okay, fine. How to remember presbyacusis is, a sloping curve. Age slopes you down towards your grave. Age slopes you down towards your grave. So presbyacusis is sloping curve. Meniere's causes rising curve. The dip at 2000 Hz in BC is Carhart's notch, is a feature of otosclerosis, and dip at 4000 Hz in ACBC is a feature of the noise reduced hearing loss, and this is called acoustic dip. Very good. Now, which one of the following is a feature of menial disease? And this is diploacusis. There are 4 QCs in ENT, and let us revise all the 4 QCs. Guys, get ready for revision of 4 QCs in the ear. Presbyacusis is age-related SNHL. Diploacusis, I hear same sound in 2 frequencies, is Meniere's disease. Hyperacusis is a feature of Bell's palsy, and it is due to loss of stapedial reflex. Bell's palsy, the stapedial reflex goes away, and that's why there's a hyperacusis. And paracusis villi, I hear better in noisy area, is a feature of otosclerosis. Let us revise the 4 QCs of ENT. Presbyacusis is age-related SNHL. Diploacusis is a feature of Meniere's disease. The hyperacusis is a feature of Bell's palsy, and paracusis villi is a feature of otosclerosis. So these are 4 questions of the MCA paper also. Okay, fine, very good. Which membrane separates scala vestibuli and scala media? Try to recall the cochlea cut section. It has got 3 compartments: scala vestibuli, scala media, and scala tympani. My dear friends, regional membrane separates scala vestibuli and scala media, and the basilar membrane separates scala media and scala tympani. Organ of Corti are lying on basilar membrane. Organ of Corti lying on basilar membrane, and organ of Corti are covered by another membrane which is called tectorial membrane. Tectorial membrane. Once again, regional membrane separates scala vestibuli and scala media. Basilar membrane separates scala media and scala tympani. And organ of Corti are lying on basilar membrane, and organ of Corti are covered by tectorial membrane. One more question over here of MCI. Sharpnel membrane is other name of pars flaccida. Try to recall the discussion in the class. Pars flaccida is the upper part of tympanic membrane. This is pars flaccida, is the upper part of tympanic membrane. Pars flaccida is here. Look at the screen. The upper part. This part is called pars flaccida, is also called sharpnel membrane. One more question, everybody. Round window membrane is also called secondary tympanic membrane. Round window membrane is also called secondary tympanic membrane. 5 membrane question in the ENT. Regional membrane separates scala vestibuli, scala media. Revise with me. When I say something, live that thing. Basilar membrane separates the scala media and scala tympani. Organ of Corti lying on basilar membrane. Organ of Corti covered by tectorial membrane. Sharpnel membrane is other name of pars flaccida, and secondary tympanic membrane is other name of round window membrane. One question means 5 discussions, 5 revisions. What is cupula in the inner ear? Cupula. Everybody try to recall this diagram. This is the utricle saccule and semicircular canal. The semicircular canal have got the sensory end organ called crista. There are 3 crista, 1 in every canal. Crista lies in the ampulla of the canal. Ampulla of the canal. Ampulla is the dilated end of canal. Ampulla is the dilated end of the canal. Ampulla is the dilated end of the canal, and crista is covered by a gelatinous layer which is called cupula. Crista is covered by a gelatinous layer which is called cupula. Sorry for that, it's hidden behind me. I'll show you again. Please see on the screen, everyone. Please see over here. Everyone, please see over here. Once again, let us revise. Crista is the sensory end organ of semicircular canal. Crista lies in the ampulla of the canal. What is ampulla? Ampulla is the dilated end of the canal. And crista is covered by a gelatinous layer called cupula. One more time, very clear concept. Crista is the sensory end organ of canal. It is located in the ampulla of the canal. It is covered by the cupula. So ampulla is the house of crista, cupula is the cover of crista. And don't forget, macula is the sensory end organ of utricle and saccule. Okay, macula is the sensory end organ of utricle and saccule. Look at the first choice. Sensory end organ of utricle saccule is macula. Okay, the answer to this question is D, gelatinous layer around crista. Now, for last 3 days, this is a patient, actually, there's a question missing over here. A patient has got unsafe CSOM, and for last 3 days, patient has developed fever with chills, headache. Now, this is important word, Whenever you see a CSOM patient with headache means think of intracranial complication. A CSOM patient with headache means think of some brain problem, okay? And pitting edema or mastoid. Guys, pitting edema or mastoid. What is the name of the sign? Gressinger sign, What is the name of sign? Gressinger sign. and Grissinger sign is a feature of sigmoid sinus thrombosis. You might ask me, Rajiv, why it is not mastoiditis? In mastoiditis, first of all, there is no headache. Mastoiditis will never have a headache, beta. Number two, there is no pitting edema, beta. There is edema but not pitting edema. There is edema but not pitting edema, beta. Am I clear? There is edema but not pitting edema. Okay, clear? Fine, very good. So don't mark mastoiditis. So the clue in this question is, whenever in a CSOM patient with ear discharge and all that, you get headache, think of some brain problem, beta. Sigmoid sinus thrombosis has got Grissinger sign, and that is pitting edema on the mastoid, beta. What is Bill's bar? If you remember the internal auditory canal in the brain side, beta, internal auditory canal, also called internal auditory meatus, it has got a vertical bony septum, and that is called Bill's bar. Bill's bar is a vertical bony septum in the internal auditory meatus, which is also called internal auditory canal. This is already an MCI question, beta. Bill's bar is seen in the upper part of the internal auditory canal. It is actually the you can say that in the upper part of internal auditory canal there is a bony septum, and that bony septum is called Bill's bar, beta. Bill's bar, okay? Bill's bar is a vertical bony septum in the internal auditory canal, beta. Now, a patient of head injury with bluish discoloration over mastoid area. Bluish discoloration over mastoid area, this is called Battle sign, beta. Battle sign. It is seen in the fracture of the skull bones, beta. After 3 days of head injury, patient develop facial palsy. What's the treatment plan for this patient? Please say, this is delayed onset facial palsy. Delayed onset facial palsy is due to edema of the nerve, and the treatment is oral steroid, beta. Treatment is oral steroid. Am I clear, beta? After temporal bone fracture or skull injuries, there are two types of facial palsy. One is immediate onset, other delayed onset. Immediate onset means facial has been cut. Immediate onset need immediate surgery. Delayed onset is due to edema, it needs steroid, beta. Am I clear, beta? So, after the skull injuries, immediate onset facial palsy need immediate surgery. Delayed onset is due to edema, and that need steroids, beta. That needs steroids. Very good, beta. So, the clinical scenario based question. After 3 days, why it is delayed, beta? Read the question carefully. He is saying that the patient has got facial palsy after 3 days, beta. Never skip the key word, beta. Keyword should not be skipped, beta. If you know a question, look for the key word, beta. Immediate onset admin, immediate surgery. Delayed onset, steroids, beta, for edema. Okay, keyword should not be missed, beta. Identify the maneuver being given in the image, beta. Two positions, beta. Sitting and the lying down, beta. Look at the maneuver, sitting and lying down. I hope remember two position in the maneuver is Dick-Solpike maneuver, beta. Apley maneuver is 5 positions, beta. Apley maneuver is 5 position. Gutsman maneuver is for puberphonia. When you press the larynx, beta. Puberphonia. Hamlish maneuver is for the foreign body aspiration. 4 choices, 4 MCQ revision, beta. Apley maneuver has got 5 position. Dick-Solpike maneuver is 2 position, beta. I will show you at the end the images also. Dick-Solpike 2 position, Apley's 5 position. Try to recall. Dick-Solpike maneuver is a diagnostic test of BPPV. Apley's maneuver is a therapeutic maneuver for BPPV. One more time. Dick-Solpike maneuver is a diagnostic test of BPPV, and Apley maneuver is the therapeutic maneuver for BPPV. And don't forget, Gutsman maneuver, when you press the thyroid cartilage backward, is a treatment of puberphonia. And finally, the Hamlish maneuver, when you press the epigastrium backward and upward, is a treatment for the foreign body in the larynx, foreign body aspiration, beta. Okay, fine. Now, a patient of right unsafe CSOM has presented with double vision and pain behind right eye. What is the name of this entity? Please see, unsafe CSOM with the diplopia, double vision and retroorbital pain. This is Grady-Nigo syndrome, beta. Grady-Nigo syndrome, beta. Nobody will mark Grissinger sign, beta. Please don't see Grady-Nigo G, Grissinger G. In a hurry, you might mark the question wrong. We will not do these kind of silly mistakes in the paper. We will be reading all the 4 choices. Think for few seconds and then mark the answer carefully. If you know it, you know it. Grady-Nigo syndrome is other name of petrositis. Petrositis. How to remember Grady-Nigo syndrome, everybody? Grady-Nigo syndrome is a very commonly asked question. How to remember? It has got a mnemonic, beautiful mnemonic, G-E-R-D. E for ear discharge. E for ear discharge. It's a complication of CSOM, na? R for retroorbital pain. retroorbital pain, pain behind the right eye, pain behind the eye due to fifth nerve involvement. And D for diplopia due to sixth nerve involvement. Nobody will forget this question, beta. Popular question should be remembered and marked carefully. Gradinigo, Grisinger, overlapping word, don't make mistake, beta. In the paper, please be careful about the question which you know. They are 100% yours, beta. You're not going to be doing mistake in the paper, beta. So, Gradinigo syndrome or petrositis, the triad is ear discharge, retroorbital pain, and diplopia. How to remember it? As GERD, beta. G-E-R-D. GERD, beta. I'm going to G-R-D, beta. Fine, very good, very good. Now, this is a possible question again, beta. A congenitally deaf child with bilateral profound SNHL. This is deaf child, beta. Bilateral, both sides. On radiological evaluation has been found a normal 8th nerve, beta. 8th nerve is okay. 8th nerve is okay. Now, this is a deaf child. What is the best treatment for this patient is cochlear implant, beta. Don't forget the cochlear implant. That very possible question. Cochlear implant is placed through round window into scala tympani of cochlea. Two questions of MCI in front of you. Cochlear implant, you put electrode into the cochlea. Through which window you put the electrode? Round window. And cochlea got three parts: scala vestibuli, media, tympani. And where does the cochlear implant electrode go? Scala tympani of the cochlea. Scala tympani. So two questions here. Very good. Round window and scala tympani. Okay, fine. Now, blood-stained, foul-smelling ear discharge with the otoscopic finding given in the image. Whenever you see the pearly white mass, it's a cholestoma. Pearly white mass is cholestoma. You know pearly white mass in the tympanic membrane is cholestoma. And try to recall pearly white mass in the upper part of tympanic membrane is which type of cholestoma? It is primary acquired cholestoma. So, I know cholestoma means unsafe CSOM. Pearly white color means cholestoma. But cholestoma different type, na? Congenital, primary acquired, secondary acquired. Whenever you see a pearly white mass in the upper part of tympanic membrane, mark it as primary acquired cholestoma. Primary acquired cholestoma. This is the visual question of NEET PG which can be asked in your exam also, beta. Okay, fine. What is battle sign? Very famous question, important question, beta. The battle sign, visual question also. It's ecchymosis on the mastoid area, beta. It's ecchymosis on the mastoid area, and if you see over here, this is the battle sign. This can be a visual question. In a head injury case, you see this kind of picture over there. This is the battle sign. Can you see a bluish color behind the mastoid? On the mastoid is a feature of the fracture of the skull base, and battle sign. You will see in a patient who comes to emergency with accidental history. The patient fell down or some accident happened. If you see a bluish color over here, there is some fracture of temporal bone, beta. Okay, so temporal bone fracture will give battle sign. It is actually seen in the skull base fracture. It's ecchymosis in the mastoid area. Beta. It is ecchymosis in the mastoid area. Now, this again a very possible question of NEET PG can come down to MCI this time. A patient of left aticoantral CSOM. When I say aticoantral CSOM, I mean unsafe CSOM. Beta. Okay, with history of headache, again I'm telling you, headache means intracranial brain problem, beta. Very simple clue, beta. CSOM patient with headache, think of brain problem only. And patient has got convulsions, beta. Unfortunately, patient develop epileptic attack. So CT scan picture is given. Look at the CT scan picture. Can you see a beautiful abscess over here, beta? This is the case of temporal lobe brain abscess. It's a case of temporal lobe brain abscess, my dear friend. Temporal lobe brain abscess. This is a case of temporal lobe brain abscess. One second. Temporal lobe brain abscess. What is the treatment of temporal lobe brain abscess? The answer is neurosurgery, beta. Neurosurgery. Please do not mark any other treatment. Please mark neurosurgery. Neurosurgery is the treatment. So this is the case of brain abscess in the temporal lobe. The CT scan shows the brain abscess just above the ear, and this is the case of temporal lobe abscess, and the treatment is neurosurgery over there. Neurosurgery. Okay, fine. Now, again, MCI question. In this discussion, we have revised all the possible questions which can come or which have come in the last few sessions of the paper also. Beta. A patient of ear wax underwent syringing. During syringing, patient developed syncope episode. Patient turned unconscious. Beta. Patient fell down, patient turned unconscious. Which nerve is accountable? Beta? The answer is Arnold's nerve, which is auricular branch of vagus nerve. Beta. Auricular branch of vagus nerve. Vagus, also called as Alderman's nerve. Beta. Auricular branch of vagus nerve, also called as Alderman nerve. This is supplying the external auditory canal, beta. I hope you remember during cleaning the ear, if patient started coughing, which nerve is responsible? Auricular branch of vagus. During syringing or cleaning the ear, patient develops syncope episode, means patient is unconscious. Which nerve got stimulated? Again, auricular branch of vagus, also called Arnold's nerve. You know, vagal stimulation will do what? Vagus is a parasympathetic nerve. And vagal stimulation will lead to bradycardia and hypotension. If there is hypotension, suddenly the brain will get less blood supply and you will fall down and you will turn unconscious. I've seen many times in the OPD also, during syringing, patient get unconscious. Why? Which nerve is stimulated? Auricular branch of vagus or Arnold's nerve, also called as Alderman's nerve. Next question. Which of the following is not a cause of whitish membrane on tonsil? Not a cause, beta. Don't miss the keyword. Infection mononucleosis, yes. It is caused by Epstein-Barr virus. Ludwig's angina, wrong. Ludwig's angina is not infection of the tonsil or something. It's infection of floor of mouth, beta. Ludwig's angina is something else. It's infection of floor of mouth or chin swelling, beta. Chin swelling after dental infection. Dental infection causing chin swelling is Ludwig's angina, but Ludwig's angina does not give, whitish membrane on a tonsil, beta. Vincent angina, yes. Diphtheria, yes, beta. Okay, fine. Very good. Ludwig's angina. Remember, Vincent angina, yes, but Ludwig's angina does not cause any whitish membrane on tonsil. Ludwig's angina is actually some other disease, beta. It's a chin swelling after dental infection with trismus, difficulty in mouth opening. The swelling is here, beta, not on the tonsil, any membrane. Okay. The answer to this question is B, beta. Okay. Now, read this question carefully. An 8-year-old child underwent tonsillectomy. Next day, child is crying with the ear pain, beta. After tonsillectomy, ear ache. Which nerve is responsible? Which nerve is responsible? The answer is, it's a referred otalgia through glossopharyngeal nerve, beta. Guys, try to recall. In the bed of the tonsil, you have got glossopharyngeal nerve. Ear is supplied by glossopharyngeal nerve. You did tonsillectomy. Next day, child is crying with the ear pain. What has gone wrong? Nothing has gone wrong. It's a referred ear pain through glossopharyngeal nerve, because tonsil is supplied by glossopharyngeal nerve. The same glossopharyngeal nerve supplies the middle ear also, beta. Okay, that's why the pain is actually referred by the glossopharyngeal nerve. This is a clinical anatomy based question, and look at yourself in the chat box. You're beautifully answering all these questions. It means you're conceptually clear. Trust yourself, beta. There is no end to knowing, I understand. You can know n number of things on the planet, beta. Medical science is ever, if somebody says, I know everything about medical science, if I say today, I know everything about ENT, I think the biggest fool I am on the planet actually. It's endless science, beta. You can keep on knowing, beta. That's not. But you have already known sufficient enough to pass the exam. Only thing is, please in the remaining days, maintain the morale high, maintain the confidence, and number 3, keep the speed of the revision intact. Some people start losing track at this moment of time. That's not correct, beta. That's not correct. You must make sure that every day you are extracting 12-13 hours of revision, and that this time will be the decisive time, crucial time, because you already have the sufficient information. Some subject you are stronger, some you are okay, some you are very weak. This is the way preparation is done. With this preparation only, millions of people passed before us also. We will also pass, beta. Okay, don't worry about all that. Okay, we will also pass like that only. Okay, which of the following is the main blood supply of tonsil, beta? The main blood supply of tonsil is tonsillar branch of facial artery. Okay, Harshita, you are right. The glossopharyngeal nerve gives the branch to the middle ear called tympanic branch of glossopharyngeal nerve, also called as Jacobson's nerve. Harshita, you are right, beta. Okay, fine. So tonsillar branch of facial artery is the main blood supply of tonsil, beta. Okay, this is one-liner question, beta. Which of the following is the commonest site of head and neck cancer in India, beta? Can you answer this question, everybody? Which is the commonest site of head and neck cancer in India? Okay, let me answer it. You might be thinking buccal mucosa, lateral tongue. No. This is actually the gingivo-buccal sulcus. So most common head and neck cancer is oral cavity in India. In India, oral cavity, outer oral cavity, buccal mucosa. It is not beta D. That's why I brought this question, beta. Outer buccal mucosa, it is gingivo-buccal sulcus, beta. Which part of buccal mucosa, gingivo-buccal sulcus? Please read all the 4 statements carefully. I know buccal mucosa is the commonest oral cavity cancer, but out of buccal mucosa also, which part of buccal mucosa, gingivo-buccal sulcus? This sulcus, beta, where you keep the tobacco or pan masala in this area, beta. Okay. The answer to this question is A. So if somebody has marked D, the only learning is that I must read all the 4 choices. Think that what is the right answer, beta. So buccal mucosa is the commonest site of oral cavity cancer, but which part of buccal mucosa? Answer is A, gingivobuccal sulcus. Very good, very good. Now everybody try this question now. All are applicable to juvenile nasopharyngeal angiofibroma except. Everybody. Now everybody you have to answer this question, thinking logically, because there are few questions in the paper which I am calling type B question. Type B question that you know the topic, but you are confused about two choices, beta. Have you seen now, when you are solving MCQs, you have got two choices, you are sure. They are not the answer. Out of two, you get stuck. Okay? Now, let us do the same thing over here, beta. Well, all are applicable to angiofibroma except, beta. Except. Okay? Now, everyone, just be careful in answering, beta. Careful. Everybody careful in answer. Except hormonal sinus CT scan, frog face deformity, radiotherapy is the best treatment modality, hormone-sensitive tumor. Now, the answer of this question, now please see, logically answer. That's what I want to teach you. I'm glad that you're making a mistake here, beta. Now, you think about it, that angiofibroma is seen in adolescent boys. Adolescent boys, but puberty boys, means when that androgen rush comes the body. Is radiotherapy the treatment of angiofibroma? Think again, beta. Is angiofibroma, try to recall the class and the videos and notes, beta. Try to recall, angiofibroma is a surgery treatment or radiotherapy treatment, beta. For nasopharyngeal carcinoma, radiotherapy was treatment. For angiofibroma, what was the treatment? Surgery or radiotherapy? What was treatment? Surgery or radiotherapy? The answer was what? The answer was surgery, beta. Surgery was the treatment of angiofibroma. It means that this question answer is C, beta. Radiotherapy is not the best treatment modality. It's a wrong statement. Answer C. It is a hormone-sensitive tumor. Yes. That is why, it is seen in adolescent boys. Guys, this is the classical question. Your approximately 80-100 question will be in this category. When you are sure about two choices, but other two choices are not really in your mind actually at that point. At that point, I'll say, just use your common sense. Ask yourself, when is the angiofibroma seen? In young boys, mean adolescent boys, means when puberty is happening. So puberty means hormones. Oh, it must be a hormone-sensitive tumor. But I think in my notes, I never said that angiofibroma treatment is radiotherapy. Yes, I wrote that nasopharyngeal carcinoma treatment is radiotherapy. But I never said that, angiofibroma will be having radiotherapy as treatment. Will you give a radiotherapy for benign tumor, beta? Try to recall. Angiofibroma is a benign tumor. Oh, will you give radiotherapy for benign tumor? Never. So surgery is the treatment of choice, beta. Am I clear, beta? So C is the answer, beta. Guys, this is the question which really decides our score, beta. These are the questions, beta. In different subjects, you will be getting, approximately 120, 130 questions, which are just like a cakewalk, beta. No problem. You know one-liner, you know the question, you know this thing. But there are certain questions where you have got two choices, sure, not there. Out of two, please apply your mind. Like this question, oh, it's seen in young boys, adolescent boys, puberty with a hormone. It's a hormone-sensitive tumor. But my notes never said radiotherapy for angiofibroma at least. Surgery was there, so answer is C. Mark the C, will get 1 mark over there. Okay, fine, very good. Very good. Which virus is implicated in the management or in the etiology of NPC, nasopharyngeal carcinoma? The Epstein-Barr virus, EB virus. Biopsy is contraindicated in angiofibroma, beta. Okay, biopsy is contraindicated in angiofibroma, beta. Guys, please, I would like to show you this question again, because this is what I'm not concerned about ENT only. I want you to pass the exam overall, beta, overall. This is the question in different subjects going to bother you, where you two choices they are not the answer. Out of two, you get stuck up. But please maintain calm in your head. Go with the common sense. Go with the common thought. Go with the impression of notes in your mind and play the game, beta. Angiofibroma is younger chaps, adolescent boys, hormone-sensitive tumor. Surgery was the treatment of choice. Radiotherapy was written in nasopharyngeal carcinoma, but not in angiofibroma. So the answer to this question is C. My dear friend, tell me, will you be able to address these kind of questions in the paper or no? Yes or no? I'm not saying every question will be correct, but let's play the game with a stable heart, with a common sense intact, beta. Now, a young child operated for adenotonsillectomy has developed atlantoaxial subluxation, C1, C2 subluxation. What is the possible diagnosis in this case? The answer is Grissel syndrome. Grissel syndrome. My dear friend, Grissel syndrome is the possible diagnosis in this case. And this patient has actually, why? The surgery is adenotonsillectomy. And in this patient, If you remember, in adenotonsillectomy, the position called Rose position, and there's a lot of neck extension, and when you do overextension, the C1, C2 vertebra can get subluxated, and that is called Gristle syndrome. My dear friends, let us revise the other syndrome also, Kalman syndrome is anosmia, smell problem, plus hypogonadism. Okay. Gristle syndrome is C1, C2 subluxation during adenotonsillectomy surgery. Ortner syndrome is left atriomegaly causing left RLN palsy. And Eagle syndrome is the long styloid process pressing the ninth nerve. Okay, which is fine. Let us revise the fourth syndrome question of the MCA paper. First of all, Kalman syndrome. Kalman syndrome means smell problem and fertility problem. Smell, the anosmia with hypogonadism is Kalman syndrome. C1, C2 subluxation during surgery of adenotonsillectomy is Gristle syndrome. And then comes the Ortner syndrome, means left atriomegaly here, heart problem. Left atriomegaly pressing the left RLN. Okay, left atriomegaly causing left RLN palsy is the Ortner syndrome, means heart problem causing vocal cord problem. And lastly, the Eagle syndrome is over here. Eagle, remember Eagle, long started process pressing the ninth nerve, which leads to throat pain, and that's called the Eagle syndrome. 4 questions over there. Okay, fine. Next one. What is the best treatment of a post-tonsillectomy mild bleeding? Post-tonsillectomy mild bleeding, which presents a week later after the surgery. After a week of surgery, what type of hemorrhage it is? Everybody, try to answer. It is a which hemorrhage, Yes, secondary hemorrhage, Secondary hemorrhage. You remember primary hemorrhage during surgery, reactionary hemorrage within 24 hours, secondary hemorrhage after 24 hours, mostly after 5th day. This patient is coming a week after surgery. Mild bleeding. Okay, what would you do? Readmission in the hospital and observation, immediate re-exploration, readmission and intravenous antibiotics, or give oral antibiotic and send the patient home. The answer to this question is C, C. Admit the patient again. Patient came after 1 week of surgery. It is secondary hemorrhage. It due to infection. It's a mild bleeding. Admit the patient again to the hospital and start intravenous antibiotic. You give intravenous antibiotic to control the infection. Do not give oral antibiotic and send the patient to home. There is no need of surgery. Reactionary hemorrhage, re-explore. Secondary hemorrhage, we never re-explore. Okay, fine. And you can't observe it. You have to give some antibiotic to it. So I do hope you remember RE reactionary, RE re-exploration. Okay, secondary hemorrhage, admission and intravenous antibiotics. Okay, once again 3 hemorrhage. Primary hemorrhage during surgery, reactionary hemorrhage within 24 hours surgery. It is due to slippage of the ligature and treatment is re-exploration. My dear friend, how to remember? RE reactionary, RE re-explore. And secondary hemorrhage after 5th day, like this question, treatment is hospitalization again and intravenous antibiotic. Very good. Next question, what is the exact anatomical site of formation of Zenko diverticulum or pharyngeal pouch? Zenko diverticulum pharyngeal pouch, I hope you remember it's a seen in inferior constrictor muscle between the thyropharyngeus and cricopharyngeus. Between thyropharyngeus and cricopharyngeus. Okay, this is a very popular question. This is a popular question. Okay, Zenko diverticulum or the pharyngeal pouch is formed at which area? Killian dehiscence. So he's asking indirectly, Killian dehiscence is in inferior constrictor muscle between the thyropharyngeus and cricopharyngeus. This is a possible question. Killian dehiscence is inferior constrictor muscle between the fiber of thyropharyngeus and cricopharyngeus. And it is site of formation of Zenko diverticulum or pharyngeal pouch. Next question. Oropharyngeal picture of a patient with trismus, plummy voice and dysphagia is shown in the given image. What is the possible diagnosis? My dear friend, whenever you see uvula is angulated, please think of quinsy. My dear friends, please think of quinsy. Don't mark quincke. Quincke is edema of uvula. It's a separate disease. Quincke and this is separate. Okay, it's quinsy. Quinsy is equal to peritonsillar abscess. Now everyone has a confusion because of the internet questions, either a parapharyngeal abscess or a quinsy. Let us solve it. Quinsy has no neck swelling. There are two famous equations of the ENT which you should know. Quinsy plus outer neck swelling is equal to parapharyngeal abscess. In quinsy, there is no outer neck swelling. Quinsy plus outer neck swelling is equal to parapharyngeal abscess. And one important question, atrophic rhinitis question plus hard external nose is equal to rhinoscleroma. Let me share the two important equations of ENT MCQs which will never make your question wrong in the paper. Quinsy question, along with that outer neck swelling written close to angle of mandible or close to sternocleidomastoid muscle, mark parapharyngeal abscess. But if there is no neck swelling, it will be quinsy. These two MCQs are very similar. Quinsy and parapharyngeal abscess, very similar question. Very plummy voice, uval eyes pushed to other side, tonsil pushed medially. Everything is there. Trismus is there and all that. Everything there. But quinsy never has neck swelling. Quinsy plus neck swelling is equal to parapharyngeal abscess. And then atrophic rhinitis and rhinoscleroma are two similar MCQs. But atrophic rhinitis never has outside nose change. Atrophic rhinitis question plus hard external nose is equal to rhinoscleroma. Are these two equations sounding, some use to you? Tell me yes or no. Is it going to make your life easy or no? See, quinsy plus outer neck swelling is equal to parapharyngeal abscess. Atrophic rhinitis plus hard external nose is equal to the rhinoscleroma. Matlab, atrophic rhinitis never has an outside change. Okay, fine. Is this going to help you? Tell me yes or no. These two equations, please remember. Okay, fine. Take a screenshot and keep it with you. Okay, fine. Let us make the life simple, scientifically simple, high level. But you know what? You should not have confusion in the paper. What to mark? You shouldn't know. Wonderful. Now, patient with sore throat, fever, cervical lymphadenopathy, and oropharyngeal picture in the image. What is the possible diagnosis? Please look at the screen. This is a typical picture of diphtheria. Guys, diphtheria will be asked. Diphtheria has been asked. Do not forget that. Okay, fine. So, answer of this question is diphtheric tonsillitis. Okay, diphtheric tonsillitis. Diphtheric tonsillitis. Now, few lines about diphtheria. This cervical lymphadenopathy is called bull neck. Bull neck. Okay. This membrane, few points about diphtheria membrane. Number one, it is pseudomembrane. Number two, it bleeds on removal. Number three, it extends beyond tonsil to palate and the pharyngeal walls. Once again, 3 points to remember about diphtheria in ENT. It's a pseudomembrane, yes. It bleeds on removal, yes. It extends beyond tonsil to the palate and the posterior pharyngeal wall, yes. Another point about diphtheria. Diphtheria can cause unilateral vocal cord palsy. This is a possible question. Unilateral vocal cord palsy. And the treatment of unilateral vocal cord palsy is conservative treatment. I have discussed multiple times in the class. Whenever you get a question of single-sided unilateral cord palsy, treatment is conservative treatment. Conservative treatment. Okay? Conservative treatment. Nobody will forget this question. Diphtheria can cause unilateral vocal cord palsy, and unilateral cord palsy treatment is no fancy surgery, nothing to be done, only conservative treatment. Okay? And diphtheria patient can need tracheostomy. Diphtheria patient can need tracheostomy because diphtheria membrane can block the trachea or larynx over there. Okay, diphtheria membrane can block the larynx, so you need to do the tracheostomy. So diphtheria in ENT might need tracheostomy. Okay, tracheostomy. All the following are true about Trotter's triad. Triads are very famous in ENT. All triads are MCQs of MCI paper. Triads of nasopharyngeal carcinoma, NPC. The Trotter's triad of NPC has got a mnemonic also NPC. N mane neuralgia in temporoparietal area, P mane palatal palsy, and C mane conductive hearing loss. Trotter's triad is seen in NPC nasopharyngeal carcinoma, and the features are also NPC. Let us revise the triads. Let us revise the 4 triads of ENT. Everybody get ready. Let us revise the 4 triads of ENT. Everyone. 4 triads of ENT are: number 1, Trotter's triad. It is seen in nasopharyngeal carcinoma, and the triad is also NPC. What is N? Neuralgia in temporoparietal area, P mane palatal palsy, and C mane conductive hearing loss. Why conductive hearing loss? Never ever forget, nasopharyngeal carcinoma causes unilateral glue ear, and I will never forget, glue ear is also called serous otitis media. Nasopharyngeal carcinoma is a star topic of the paper. Star topic of the paper. Am I clear? Fine. So what was the answer of this question? The answer to this question was SNHL. Never SNHL there. Conductive hearing loss, yes. It never gives SNHL. Am I clear? Fine. So let us revise the next triad. Samtus triad is an allergy triad. Allergy. Triadallergy. It is allergy to NSAID like aspirin, bronchial asthma allergy, and nasal polyp, asthmoidal polyp allergy. This is allergy. Samtus triad is a triad of allergy to the painkillers, particularly aspirin, asthma history is there, and nasal polyp, particularly asthmoidal polyp, which are allergic origin. So Samtus triad is a triad of allergy, NSAID allergy, asthma, and nasal polyp is Samtus triad. One more triad we discussed already. Gradinego syndrome triad or petrositis is GERD, G-E-R-D. E mane ear discharge, R mane retrobral pain, and D mane diplopia. Now the fourth triad, which is a visual question of derma also for NEET PG. Melkerson-Rosenthal syndrome. Melkerson-Rosenthal syndrome, three features. Number one, recurrent facial palsy. Number two, fissured tongue. And number three is lip swelling. Okay, what is the name of syndrome? Melkerson-Rosenthal syndrome is a visual question of NEET PG. Can be easily asked in your paper also. Is actually number one, recurrent facial palsy. Number two, fissured tongue. And number three, lip swelling. Don't forget this image, beta. Okay, don't forget this image. Okay, very good. Now, next question, beta. 7-year-old child underwent tonsillectomy. Okay, he shifted to the ward after uneventful recovery period. In the evening, beta. Please say in the evening, less than 24 hours. उसी दिन शाम को, in the same evening, sister notices patient is profusely bleeding from the mouth. Beta. Oh, same day bleeding, within 25 bleeding. What is the name of this hemorrhage? Beta? Yes, it's a reactionary hemorrhage, and reactionary hemorrhage need immediate re-exploration. Beta. See, beautiful question. Beta. Same day bleeding, 24-hour bleeding, reactionary hemorrhage, re-exploration. The previous question was after 7-day bleeding, beta, after 1 week. Secondary hemorrhage, mild bleeding needs antibiotic, intravenous antibiotic. Beta. I'm sure you know, you are much intelligent people, which you think that you know less, but you know enough to pass. May I say again, you think you know less, but you know sufficient enough to pass. Only thing is maintain your, morale high, maintain your confidence, have the hope that I'm passing. Keep telling yourself, I'll pass. Beta. If people can pass, I can also pass. I'm not that bad. I'm not great, but I'm not that bad. Okay. What is the commonest presentation of nasopharyngeal carcinoma? Now, this question should not go wrong in the paper, beta. Nasopharyngeal carcinoma start from N, beta. N. And N means cervical lymphadenopathy, neck. Something in the neck. Please do not mark hearing loss, conductive hearing loss. People get tempted by this, beta. Oh, hearing loss. No, hearing loss, beta. You should mark the cervical lymphadenopathy, beta. What is the cervical lymphadenopathy? It is a metastatic cervical lymphadenopathy. The cancer present with the secondary neck node, beta. Also called as secondary neck node. This is a 3-time repeated question of the MCI paper. None of you will commit a mistake in the paper. Oh, sir, by chance I heard conductive hearing loss. You will remember this conversation. Nasopharyngeal carcinoma start from N. N will start from neck. Neck means neck metastasis, neck node, or cervical lymphadenopathy, whatever. Neck word has to be there. Remember, neck word has to be there. Okay? Let's go further. Next one. Identify the anatomical area marked with the arrow. Again, 2020 August question of FMG paper. Now, this is fossa of Rosenmuller. Please understand, any fossa, any arrow above the eustachian tube opening. This is eustachian tube opening. This is fossa of Rosenmuller. It is the site of origin of nasopharyngeal carcinoma. Fossa Rosenmuller is the site of nasopharyngeal carcinoma. This is the fossa Rosenmuller. Fossa of Rosenmuller is the site of origin of nasopharyngeal carcinoma. Am I clear, beta? Fine. Okay, fine. Now, everyone, let's go further. Next one. Just a second. The surface is little. Yes. Can you see over here? This is the piriform sinus, beta. This is piriform sinus. Okay, piriform sinus. Another question of visual piriform sinus, beta. So whenever you are shown an arrow on the side of the larynx, beta. This is larynx, beta. Everybody, this is your larynx. Am I clear? Larynx. On the side of larynx, if you see an arrow marked over there, this is the piriform sinus area, beta. Piriform sinus area. Okay. Now, Next question. A patient 23-year-old has developed chin swelling with trismus following right last molar infection. I told you if you develop a molar or dental infection and chin swelling with trismus, this is Ludwig's angina. Nobody afraid. Ludwig's angina is with chin swelling. Anytime you get a question that somebody has got a dental infection and after that dental infection, patient developed chin swelling and a trismus. Chin swelling plus trismus after dental infection is a 100% clue for Ludwig's angina, and Ludwig's angina is infection of floor of mouth or submandibular space. Okay, fine. Next question, short question of MCI beta. Young boy, 13-year-old boy, presenting with cheek swelling, recurrent epistaxis, and reddish nasal mass in the right nasal cavity. What is the possible diagnosis? Is angiofibroma, also called as juvenile nasopharyngeal angiofibroma. Let me tell you how people commit mistake in the paper. Please see on the screen. Everyone, this is you say, oh, my notes probably had cheek swelling. I don't remember cheek swelling was not there or not. Though we said in the class that tumor goes to the cheek, beta. But you may not have cheek swelling, there is not. Guys, forget about cheek swelling. Young boy, nasal bleeding, angiofibroma. Let us maintain the main theme of the question in our mind. Let us not dissect every symptom and sign given. If the main theme matches with your concept, please mark the answer on the basis of that concept only. Let us not get deviated too much in the paper. Okay? Okay, guys, trust me, trust me, you know the answer. But only thing is, over dissection of the question will take us away from the right choice. Oh, cheek swelling, I don't know. No problem. Young boy, nasal bleeding, angiofibroma, also called as juvenile nasopharyngeal angiofibroma. Guys, trust yourself. Believe me, there is knowledge within you right now. Only thing is, in last few days, people start getting demoralized, too scared of the result in the exam. What will happen if this or that? Forget about that, yeah. Let us be little bindas, let us chilled out. Let us be totally studying, focus revision, doing as much as we can, beta. As much as we can. I understand everybody has got few subject weaker, beta. I'm not going to really say ideal things over here. But let us try to do those subjects also. I will do the anesthesia as week. I'll do TND paper of anesthesia. I might do the one liner of anesthesia. I will not leave anesthesia completely. I'll do smart study in the remaining days, beta. You are very close to making it. Just maintain this positive, thought in your heart that I'm going to pass. That thought should be kept within you. I'm not perfect. I don't think that I know that much, but I know sufficient enough to pass the exam. Okay, that please mark this line. I do not know everything but everything, but I know sufficient enough to pass the exam. I will revise, and last week I'll have a last look and pray to God and go to the exam. Let us try this. It works. Identify structure, mark the image. Look at this image. This is a Waters view. This is a X-ray PNS Waters view. Very popular question of your paper. Waters view is done with open mouth. It is done with open mouth. Okay, and this is actually the best view for sinuses. It shows all sinuses except posterior ethmoid. Okay, so Waters view is the best X-ray view for sinuses. It shows all sinuses except posterior ethmoid. It is done with open mouth. How you drink the water? Waters view, beta. How you drink the water? With open mouth, na? It is done with open mouth. Now he asked that what is this sinus, beta? This sinus is the maxillary sinus, beta. Maxillary sinus, and this is orbit. Above the orbit, this one is the frontal sinus, and through the open mouth, if they ever ask you, this is sphenoid sinus, beta. Okay, they ask you maxillary sinus. In this question, the maxillary sinus is right below the orbit. Below the orbit is maxillary sinus. Above the orbit is frontal sinus, and through the open mouth you see the sphenoid sinus. Sphenoid sinus. Okay. Yes, Nishta. Yes, somebody is asking PRS view. Water view with open mouth is also called PRS view. You are right, Nishta. That water view with open mouth called PRS view, but don't get confused. PRS view only once came in the NEET PG paper. Generally, the question asked is water view. Every time when you're confused, go with the commoner things over there. Okay. 65-year-old patient is complaining of long-standing mucopurulent discharge from the left eye. Left eye. Oh, so Rajiv, why eye question? Yes, I'll tell you why. Left eye. With a swelling near medial canthus. Please see. This is the patient. This is the patient. And this disease is called DCR. Chronic dacryocystitis. Chronic dacryocystitis. Chronic dacryocystitis is a lacrimal sac chronic infection, and the surgery is called DCR surgery. The surgery is called dacryocystorhinostomy surgery. Don't go for lacrimal sac probing, lacrimal massage. No. It's a dacryocystorhinostomy. You open the lacrimal sac in the nose, and DCR opening is made in the middle meatus. Am I clear? The chronic dacryocystitis means lacrimal sac infection. For that, use surgery called DCR surgery, dacryocystorynostomy, and a DCR opening is made in the middle meatus. Okay, middle meatus. I hope you remember nasolacrimal duct open in the inferior meatus. One more time, natural opening of duct is in the inferior meatus, but the surgical opening of DCR is in the middle meatus. Now, one last time a question: what is this instrument? It was asked in the paper also. This is called endoscopic DCR punch, or the complete name is Carrison endoscopic DCR punch. DCR is dacryocystorynostomy. To break the bone, we have to use a punch called endoscopic DCR punch or Carrison endoscopic DCR punch. Okay, I already put this picture many times in the Telegram group also. Carrison endoscopic DCR punch also. Very good. Yeah. A wide roomy nasal cavity with thick crust formation. Oh, and bad odor from nose is seen in. I told you, it is atrophic rhinitis. Bad smell from nose, crusting in the nose, wide roomy cavity, atrophic rhinitis. Same question. If you write hard external nose also, anybody, what will the answer be? Same question plus hard external nose, the answer will be rhinoscroma. Now I'm 100% clear, beta. Okay, fine, beta, fine. Yes, Vishnu, in children we definitely go, but children do not get chronic dacryocystitis. This is chronic dacryocystitis is a disease of little old age people. Okay, fine. Thickest formation and bad external nose. The same question is atrophic rhinitis, but if the same question is asked with the hard external nose, the answer will become rhinoscroma. Okay, but this question answer is A. Because there is no hard external nose given. What is the other name of rhinoscroma? Woody nose. Woody nose. Now, very important topic for your paper, bilateral complete choanal atresia. What is choana? Choana is the posterior opening of nasal cavity. In some children, choana is blocked since birth. Look at this picture over here, beta. Please see, choana is blocked, blocked since birth. Okay, now, bilateral complete choanal atresia is a neonatal airway emergency. It's a neonatal airway emergency. Why? Because nose is blocked from behind and children do not know they can have option of breathing through the mouth also. So this child will be having cyanosis at birth. Cyanosis at birth. And why it is so? What is the cause of the airway problem in this child? Neonates are obligatory nasal breathers. C is the answer. This is a repeat question in your paper. This can be repeated question in your paper. Bilateral complete choanal atresia is a neonatal airway emergency. The reason is children do not know they have option of breathing through the mouth also. They are obligatory nasal breathers. They only breathe through the nose only. So that's why they get cyanosed right at the delivery time. But when they cry, they turn pink. Blue baby turning pink on crying is a clue for choanal atresia patient. I repeat, the child will be cyanosed blue. But when the baby cries, open the mouth, oxygen goes in the body, suddenly the child turns pink. A blue baby turn pink on crying is a clue for which question? The choanal atresia question. So neonatals are obligatory nasal breather. Okay, fine. Now please see this next question. Newborn baby is cyanosed at birth. The baby turns pink on crying. Oh, this is a case of choanal atresia. Pediatric question, ENT question, both. Choanal atresia. Okay, what is the immediate management? Is a McGovern technique. Again, already asked question. McGovern technique. Fine. McGovern technique is what? Put wide bore nipple in child's mouth. Wide bore nipple in child's mouth. Wide bore nipple. Just put a wide bore nipple or oropharyngeal airway in the child's mouth to keep the mouth open, because if the mouth is open, baby will not die. This is a life-saving thing for the baby. Okay, fine. It's called McGovern technique, or put a wide bore nipple. It is used in choanal atresia baby. Choanal atresia is a likely question in your paper. Okay, fine. 2 points to remember about choanal atresia. Choanal atresia bilateral is a neonatal airway emergency because neonates are obligatory nasal breathers. And the immediate treatment is McGovern technique, means putting wide bore nipple in the child's mouth. Next one. Hypertensive epistaxis not controlled by anterior and posterior nasal packing. What is the further treatment option? The bleeding could not be controlled by anterior packing or posterior packing. When the bleeding of the nose cannot be controlled by packings, then you go for ESPAL. What is ESPAL? Everybody, ESPAL. Endoscopic ligation of sphenopalatine artery. Endoscopic sphenopalatine artery ligation. Endoscopic sphenopalatine artery ligation. Endoscopic sphenopalatine artery ligation. This is the first thing to be done if the packings fail to control the bleeding. Okay, fine. I remind you, beta, the question asked in the last 5-6 sessions have been already covered in this presentation, beta. And question expected also are covered in this presentation because there is a theme of the paper which goes on actually like that. Okay, fine. All of the following are true about CSF rhinorrhea. Very important topic, CSF rhinorrhea, beta. Cribriform plate is the commonest site of leak, yes. CSF leaking from the nose, the treatment is conservative, beta. Don't do immediate surgery. Wait and watch because the most of the leaks are due to fractures and the fracture can heal on their own, beta. So this is the wrong choice. Do not do immediate surgery, beta. The treatment is conservative, beta. The best radiological investigation, HRCT skull base, is the best radiological investigation. And this is the MCA question. What is the best confirmatory test is beta 2 transferrin estimation is the most confirmatory test for CSF rhinorrhea. The answer to this question is B. The CSF rhinorrhea should not be treated immediately. You should really keep it, little conservative treatment because a lot of leaks stop on their own. Beta. Okay, fine, very good. Next one, beta. Now everybody focus on this question, beta. Focus on this question. Which of the following is not part of Bent and Kuhn major criteria to diagnose allergic fungal rhinosinusitis? Now, fungal culture positive, CT scan of sinus show double density opacity, type 1 allergic reaction, nasal polyposis. Now, ask yourself, do you ever know what is Bent and Kuhn criteria for diagnosing allergic fungal sinusitis? Do you know what is allergic fungal sinusitis? No. Do you know Bent and Kuhn criteria, major criteria and minor criteria? No. You don't know. You don't know this, you don't know this, you don't know this, you don't know this. Approximately 100 questions will be in this category, beta. And I call them type C question, beta. I call them type C question, beta. You don't know anything, beta. You don't know anything. When you don't know anything, then you have to do one thing, beta. When you don't know anything, you have to do one thing. What? 100 question approximately, 80 to 100 question will come like this only, beta, in the paper. Like that only. When you don't know anything about the choices, about the statement, about anything, just remember my face over there. This guy told us that there will be 80 to 100 question of this type when you would not know the choices, when you would not know the statement, you have never heard the Bent and Kuhn criteria, major or minor, none of the choices known to you, and just accept that you don't know. Because approximately every third question of paper will be like this only. Just remember my face over there and then have a beautiful smile, beta. Beautiful smile, and then mark the most beautiful choice. Whatever comes to your mind, you mark it, beta. Whatever comes to your mind, you mark it, beta. So I'll mark it type A choice, and A is the correct choice, by the way. Okay, fine. So such kind of like last time we said that Ragla-Petty syndrome, like there is nothing like, I don't know what syndrome is that actually. I don't know the syndrome name even. Today's Bent and Kuhn criteria, something else will come and all that. Guys, please do remember one thing, beta. Please do remember one thing. If you are remembering my face 100 times in the exam, still you are comfortably passing the exam, beta. Let me say it again, beta. Important message for you guys. If you do not know a question, if you do not know the choices, if you do not know the main statement of the question at all, the total alien question is there, just remember my face over there, smile and mark the question, whatever most beautiful choice comes to your mind, and just go ahead, beta. Just go ahead, okay? Guys, don't worry. Even if you do not know every third question of paper, 200 questions are there still. Out of 200, we have to score, 150, not 150, 140. You know why? Out of 100 guesses, you're going to score at least 10 out of them, beta. So you are very close to passing, beta. Only thing is sometimes we get too much touchy about things. I don't know this, I don't know that, but we forget what we know. We are not complimenting ourselves for what the knowledge we have acquired in the last few months. We are only criticizing ourselves for the time we wasted, for the topics we missed, for the subject are weaker and all that. But you are forgetting your strength areas, beta. You are not focusing on your strength areas. In last few months, you have gained so much of knowledge in different subjects. It may not be great in every subject, I agree, that's not a problem. But that is sufficient to pass the exam. Hold yourself, respect yourself first of all. Congratulate yourself that you have been trying your level best after first failure, second failure, third failure. You're still trying actually. That's the most beautiful thing actually. No, not everybody can try. People could have really left it better. If you're a repeater, you can really think, you can be in sync with what I'm saying actually. It's not easy to repeat. I understand that pain, you know what. But congratulate yourself that you have been trying to repeat and make sure to pass the exam. And let me tell you very, very, very truthfully that you're very close to making it. But don't get too much bothered about why the question which you do not know. Focus on your strength area, try to score maximum, reduce silly mistake, don't over dissect the question, and such question when you remember, just remember my face and try, please, and there will be 4 or 5 times, trail of question, 3 question, no knowledge, 4 question, no knowledge, beta. maybe some question like 5-6 question, sequential question, no knowledge, no problem. Hold your horses, bro. Keep your feet on the ground, right, very stable over there. Keep playing the game till the last second is over. Believe me, this is the way actually the game is played. This is being a warrior. Means I know my weaknesses, but let me score maximum out of whatever I can. Okay, fine. Fine. So don't worry about it. That happens, believe me. Okay, fine. I'll tell you how to mark the beautiful guesses also. So Sunil, 7-year-old child, has presented at the midnight emergency with the issue of putting disc battery in the nose, beta. I told in the class also, disc battery in the nose, in the esophagus is a dangerous thing because disc battery can release alkali and can damage your tissues. So for the battery, remove urgently, beta. Do not remove next day, beta. Next day removal may be dangerous because battery might release the alkali and that can damage your tissues. So battery as a foreign body should be removed urgently, beta. Urgently. Now, given two features, beta. Please see over there, beta. Please see. The first one is saddle nose. Saddle nose. And the second one is perforation of septum, beta. Perforation of septum. These two are seen in syphilis. And which syphilis? Tertiary syphilis. Tertiary syphilis. I hope remember syphilis causes perforation of bony part of septum. Bony part of septum. Syphilis causes perforation of bony part of septum, my dear friends. Am I clear? Beta? Syphilis causes perforation of bony part of septum. Which stage of syphilis? Tertiary syphilis. Beta. Saddle nose, tertiary syphilis. Septal perforation of bony part, tertiary syphilis again. Beta. What is the significance of this line, beta? What is the name of this line? Ongral line. Very famous question, visual question, beta. Ongral line is from medial canthus to the angle of mandible. It is used in the carcinoma of maxillary sinus to assess the prognosis. Any cancer above this line will have a poor prognosis due to early orbital involvement. Let's revise. Ongral line is from medial canthus to the angle of mandible. This line is used for cancer of maxillary sinus. Any cancer above this line will have poor prognosis. So basically, it is to assess the prognosis of this cancer of maxillary sinus. So what is the answer to the question? What is the significance of this line? Answer is C, prognostic evaluation of carcinoma of the maxillary sinus. Very good. Very good, Vikash. Wonderful. Now, everyone, let us see why we do silly mistake in the paper in this question. Everybody focus on the question, everyone. Please see how we do silly mistake in the paper. 29-year-old with diabetic ketoacidosis. Oh, ketoacidosis never came in ENT. No problem. Diabetes, younger patient. Presents to emergency in a critical state with deranged vital. Examination shows blackish necrotic debris in the nasal cavity. Young diabetic, blackish mass in the nose is mucormycosis for sure. I am 100% sure. I will stick to the theme of the question. I will not. Ketoacidosis not given my notes? No problem. It's mucormycosis. What a treatment plan? Amphotericin B? 10% people say, oh, amphotericin B. They will not read another choice even. A. They'll say A. A is the wrong choice. Debridement. It's a dead tissue, na? Necrotic debris, dead tissue, na? Debridement. Then C. This is very tempting. Oh, liposomal amphotericin B is the correct choice. No. Even that's not the correct choice. D is the correct choice. Liposomal amphotericin B plus debridement. D is the correct choice. As you come down, answer get better, better and better. So I commit today. Howsoever simple the question may be, I will at least once see all the choices. Howsoever simple the question may be, I will not do in a hurry. I will not do in a hurry. I will be reading at least all the 4 choices till the end, till the end. Okay, am I clear, fine. So type A question, are simple question. You know it is mucormycosis. Read till the last choice and you know the answer, This will fetch you mark in the paper, We are doing more silly mistake than we even know. Let us make a habit. Simple question, I will go till the D choice, Every choice, read once. Oh, no over dissection. Okay, main thing. Oh, liposomal amphotericin B, yes, plus debridement also because dead tissue should be debrided, Okay, very good. Next question. 18-year-old young male was hit with cricket bat on face 2 days ago. 2 days ago, Okay. X-ray is given. This is a nasal bone fracture, This is a nasal bone fracture. But patient has developed swelling, Swelling. I told you, old fracture of the nose with swelling, treatment is fracture reduction after 7 days, Answer is C, Why? Nasal bone fracture has got 2 questions. Fresh fracture with no swelling given, immediate fracture reduction. Old fracture after 2 days came, swelling given, then wait for 7 days for swelling to reduce and then do the fracture reduction. Am I clear? So nasal bone fracture reduction treatment is immediate reduction, but if swelling is given, then I wait for 7 days and then do the fracture reduction. The answer is C. Now, A male patient resident of Tamil Nadu, beta. Let me tell you one secret. Tamil Nadu patient with nasal mass is rhinosporidiosis, beta. South India, Tamil Nadu patient with nasal mass is rhinosporidiosis, and I'm sure you know this is called mulberry-like or strawberry-like nasal mass, beta. Mulberry-like or strawberry-like nasal mass, beta. Rhinosporidiosis, what is the drug of choice? Is Dapsone, beta. What is the drug of choice? Dapsone. Rhinosporidiosis has a D. D for Dapsone, beta. If you are confused, rhinosporidiosis, Dapsone, D. Rhinosporidiosis, a D. D for Dapsone, beta. D for Dapsone. Am I clear, beta? Fine. Very good. Now, trauma question, MCA question, beta. Please see on the screen. Patient 7-year playing fell down. Trauma. Okay. Developed nasal blockage of both sides. There is swelling around the nose. Picture is given. This is a case of septal hematoma, beta. Whenever you have got bilateral nasal blockage, you should think of septal hematoma. Trauma history is there. The treatment is aspiration of septal swelling, beta. This is a popular NEET PG, FMG question both. Patient was cycling, two kids were playing, fell down, both sides got nose blocked, bindas, beta. Septal hematoma marker. Septal hematoma. Septal hematoma is due to trauma. It's mostly bilateral. Bilateral, beta. Treatment is aspiration of septal swelling, beta. Am I clear? A is the answer. Now, again, this target sign or hello sign is a feature of. A lot of people say, oh, Raji CSF rhinorrhea, but that's the wrong choice. Read till the end. A, B, C, D. Oh, it's not C, but it is D. Traumatic CSF leak, beta. Traumatic. Why? Traumatic CSF leak is blood mixed CSF. This is a very commonly done mistake by people. They say target sign or hello sign is seen in CSF rhinorrhea. No. It is only seen in traumatic CSF leaks. Okay? Traumatic CSF leak, which is blood mixed CSF. So on filter paper, it gives target sign or hello sign. By chance in your paper, the word hello sign is not there and they write double hello sign. Would you change your answer, beta? Or would you accept it? You will accept it, beta. Double hello sign. No problem, beta. The picture is given over there. Such kind of variation, don't over dissect and change the answer. Little bit of variation in the language of the examiner is due to, because every examiner read different books, beta. Somebody call it target sign, somebody hello sign, and a lot of people call it double hello sign also, beta. I am trying to tell you today why. I want to inform you not for ENT, for other subjects also. Little bit of variation. I will not really change my answer because of that. I will accept double hello sign is one same thing. Patient ENT examination was found to be non-responsive to smell of coffee, tea, asafoetida. What is asafoetida? Hing. You know, hing is a powerful spice. If you cannot smell hing, you are suffering from anosmia. Anosmia, patient can smell ammonia, beta. And ammonia is sensed through trigeminal nerve, beta. I hope remember, a patient of anosmia can still sense ammonia. Ammonia is not a smell. Ammonia is an irritant. It is sensed through fifth nerve or trigeminal nerve. The two questions here, two questions, ammonia and trigeminal nerve. I tried to devise these questions in such a way that we are getting to revise multiple points in this span of time only. Identify the findings shown in the CT scan. Now, if you get this question in the paper, don't get scared, beta. Certainly high level question come, try to say ethmoid air cell. Okay, let us analyze this CT scan, beta. He says, tell us that what is this arrow indicating to? Oh, just even if you have never seen CT scan, it is orbit, beta. Orbit you know, na? And a cell below the orbit will be called which cell, beta? You tell me. Heller cell. Very good, Heller cell, beta. Heller cell, na? This is a Heller cell, beta. So you can answer this. Don't think that everything you will be knowing before paper only. On the exam day, something come fresh, but you are evaluating it in a good way and you answer it, beta. Okay, Heller cell, beta. Guys, bulla ethmodalis is MCA question. Let us revise. What is bulla ethmodalis? It is the constant and largest anterior ethmoid air cell. Agar nasai is NEET PG question. Agar nasai is anterior ethmoid air cell. Once again, bulla ethmodalis and agar nasai are constant cell. Bulla ethmodalis is the constant and largest anterior ethmoid air cell. And agar nasai is anterior ethmoid air cell. If you remember, I told you in the class also, agar, A-double-G-E-R, agar nasai, A-double-G-E is aage. Aage means most front, beta, aage. If you don't know Hindi, but A-double-G, aage, aage means anterior, aage. So agar nasai is most anterior cell, beta. Let us revise the other cell, beta. The Heller cell is in the orbital floor. And Onodi cell, beta, Onodi, O-N-O-D-I, Onodi cell. Onodi cell, how to answer this question very easily? Onodi cell, O-N matlab optic nerve, beta. Never this question will go wrong. O-N means optic nerve. O-N means optic nerve, beta. Optic nerve, beta. Okay, bhai? Optic nerve beta. Am I clear beta? Only optic nerve beta. And lastly, concha bullosa beta. Concha bullosa is pneumatization of middle turbinate beta. Concha bullosa is pneumatization of middle turbinate. When you have a cell within middle turbinate, it's called concha bullosa beta. Okay, let us revise 5 cell beta. Bulla ethmodalis is the largest and constant anterior ethmoid air cell. Agar nasai is the anterior-most anterior ethmoid air cell. Onodi cell, optic nerve. Haller cell, orbital floor. Cell within the middle turbinate, concha bullosa. Next question. 43-year-old male patient present with the roomy nasal cavity filled with crust, disfigured hard external nose is of course rhinoscloma beta. Biopsy is given. I hope you remember biopsy shows Russell bodies and Macula cell. Okay. What is the drug of rhinoscloma beta? Rhinoscloma is streptomycin plus tetracycline. I will not confuse rhinosporidiosis with rhinoscloma. Rhinoscloma, streptomycin and tetracycline. Rhinosporidiosis has a D for Dapson beta. Okay. What is the classical histopathological picture of rhinoscloma? Russell body and Macula cell. It's also called woody nose beta. Woody nose. Woody nose beta. I hope you remember beta. Rhinophyma is potato nose beta. Rhinophyma. Nobody will confuse for rhino beta. Rhinophyma is potato nose. Potato nose is hypertrophy of sebaceous glands of the skin of the nose. Potato nose is the hypertrophy of sebaceous glands of the skin of the external nose beta. Now, this is a very possible question again beta. 23-year-old person suffering from frontal sinusitis has developed a painful red forehead swelling. What is the name of this entity? Of course, Pott's puffy tumor beta. Please do not forget this word. A Pott's puffy tumor is infection of the frontal bone beta. Definition: it is subperiosteal frontal abscess beta. Now this is not a tumor beta, it is a pseudonym. Pott's puffy tumor is not a tumor, it is subperiosteal frontal abscess beta. Okay, guys, don't forget Ringer's tumor also beta. Ringer's tumor is really a tumor. Ringer's tumor really a tumor. It is inverted papilloma of nose beta. Inverted papilloma of nose. Very good. Inverted papilloma of nose, my dear friends. Inverted papilloma of nose. Next, which of the following is unpaired cartilage? Very simple question, beta. Thyroid is unpaired, yes, but cornicular, cuneiform, and arytenoid are paired cartilage. I hope remember Epiglottis are unpaired cartilages. Unpaired cartilages. Very good. Unpaired cartilages. You know, such question come in last time this question came, beta. There are easy question also, beta. Don't worry. Every question on MCA paper will not be damn difficult for you. Don't worry about that. That's a wrong. I'm saying 120, 130 will be easier question for you. Don't make silly mistake in that, beta. That's the only request. Read the question properly, beta. Okay, fine, everyone. I have told everyone in the class also, but people who are new over here, let me address everyone now. In the paper of MCA, there are 3 types of question. Type A question, type B question, type C question. Type A question which you know. Like this question is type A question. Oh, thyroid is an unpaired cartilage. I will not do mistake in this question. But I cannot be in a hurry to answer this question in the wrong way. It's my prime, source of the marks over there. Type A question are easy question, known question, 100% known question. Type C question are unknown question. Ragra-Patty syndrome, Benton-Kuhn criteria. I don't know all that. Type C question. Type A question, type C question. Type A 100 to 120, 130. Type C 80 to 100 question. In between type B question. Type B is something which you know, something which you don't know. Like angiofibroma question. Is a hormone sensitive tumor or radiotherapy treatment of choice? Apply your common sense over there. Type B question will need time. Type B question will need your common sense. Type B question will need your focus of mind also. Why we make the type B question wrong? Because we are under the hangover of the type C question. I don't know Benton-Kuhn criteria. I don't know Ragra-Patty syndrome. But now when I do the angiofibroma question, I am in a very low mood and I do the silly mistake in that also. Because I am not able to analyze that because I am under the hangover of the previously unknown question, type C question. Okay? Please understand, people give lot of attention to type C question. This Benton-Kuhn criteria, this Mirald-Gubler syndrome, Hereford syndrome. I don't know all that. No problem. Type C question, we really are after that. But type A question, we ignore that. Like, which of the following is unpaired cartilage? I don't know why I'll mark on that day, arytenoid unpaired. I remember, thyroid was unpaired. Yaar. Oh, he was asking unpaired actually. Oh, sorry, I did not read it properly actually. So that would be not a good thing. Na? So type A question need your attention, beta. Type C question need just smile, remember my face, mark the most beautiful choice and go ahead, beta. That's all. Now, how to create analogy for type A and type C question. Beta. This would really, I'm sure it will touch your heart for sure. Guys, when you have a newly made bond, like girlfriend, boyfriend, all that, in the beginning you are so like connected, WhatsApp, Insta, whatever, like everything, every night, good morning, everything is going on. After a few months and a few more months, then you get used to each other. Then what do happen that what things start getting like you start ignoring things actually. Now on a Valentine Day, the girlfriend is sitting just across the table and she represents a type A question which belongs to you, which is yours. And you are busy on the WhatsApp. Actually. You're busy on the WhatsApp like that. You are doing. She's talking to you, very important thing, but you are not concerned about her anymore now. You are just. She's type A question, by the way. You are doing WhatsApp, and suddenly another girl passes from there in the restaurant, and then you take your whole neck and like that, and you see it. This girl, unknown girl, is a type C question. You are focusing. You are rotating your neck for seeing her. You know what, this was never yours, this will be never yours, she has gone over there, she never belongs to you, she is not yours, she gone away. By the time you went back over here, this girl also went away. This is type A question also gone, type C was never yours even. Please pick up this energy, please shift this type C energy into type A. Beta. Let us check these questions before we mark them. Beta. Let us not be in a hurry. Beta. If you do this, then it will be a problem. Beta. Then you're investing the thing in the wrong way. There's no productivity over there. In type C question, you have to just mark the instinct only over there. Okay, fine. Now let's go to the next question. Which of the following cartilage of larynx does not ossify with age? Beta? Epiglottis is elastic cartilage. Remember, epiglottis is elastic cartilage. Okay, fine. Elastic cartilage, and it does not show ossification. Beta. Elastic cartilage, it does not show ossification. Beta. Okay, fine. Beta. Fine. Next question. Beta. Next. Which of the following is the initial symptom of glottic malignancy? Glottic malignancy, glottimal vocal cord cancer. Particularly, it is hoarse voice. Beta. Vocal cord problem is voice problem. Beta. Voice problem. Beta. Fine. Fine, bache? Fine. Chalo. Okay, fine. Now, let me tell you the type C question one more time. Everybody, how to solve a type C question with a smile on your face, with remembering my face. But sometime in type C question, you know that something is very unique. Beta. Please see. Which of the following is not true about cochlear implant surgery? Okay. You don't know the choice A. Multi-channel implant are better results. I don't know them. I don't know what are multi-channel implants. Posterior tympanotomy is the essential step of the surgery. I never read surgery. I don't know this. Beta. But look at C and D choice. Beta. Cochlear implant surgery is a possible treatment in Mondini's dysplasia of cochlea. And D choice is cochlear implant surgery is a possible treatment in Mondini's dysplasia of the cochlea. Is a contraindication. Beta. Is a contraindication. The first choice is a possible treatment. The second is contraindication. Beta. Now, these two choices are very close. Beta. If in a type C question, two choices are very close, answer is out of them. Beta. The C choice says the Mondini's dysplasia, you can do the cochlear implant surgery. D choice says in Mondini's dysplasia, the surgery is contraindicated. So C and D are exactly diagonally opposite of each other. So one of them has to be correct. Apply your common sense over there. In type C question, I don't know what is multi-channel implant. I don't know what is posterior tympanotomy. But in my common sense says C and D are diagonally opposite to each other. If two choices are diagonally opposite to each other, then mark only out of 2. The advantage is this will make your chance of becoming correct 50%. Earlier it was 25% beta, out of 4-1. Now you know 50% chance of becoming correct because either it is C or D beta. Either C or D. The answer is actually D beta. D. It is not a contraindication beta. There is you can do the surgery in cochlear implant in Mondini dysplasia of cochlea also. This is not important. You don't need to know Mondini dysplasia. I'll tell you example of this question beta. If two choices in medicine surgery, unknown question, are diagonally opposite to each other, please mark one answer out of those two choices only out of any question beta. Whenever you have two diagonally opposite answers, answer lies in out of these two only. Your chances of becoming correct are 50% now rather than 25% beta. Okay, fine, fine. Now, identify the structure beta marked. Please see, this is, he's asking, this is epiglottis beta. This is epiglottis, my dear friend. This is epiglottis beta. Okay, fine. Again, this question came in your paper also beta, epiglottis. So we have done the marking of piriform sinus, we've done the marking of fossa of Rosenmuller, and this is epiglottis beta. This is epiglottis, my dear friends. Now, a singer has undergone thyroid surgery 1 month back. Her recovery has been satisfactory, but she is a singer, but she says, I am unable to sing higher notes now, means poor quality of voice. Poor quality of voice. She has got poor quality of voice now, and that is due to the loss of cricothyroid function. And cricothyroid is a tensor, and this is supplied by external branch of superior laryngeal nerve. Beta. I repeat the question, beta. This is a singer, underwent thyroid surgery. She is unable to sing the higher notes, means poor quality of voice. Unfortunately, she has unable to sing the higher notes. Actually, she has developed some quality of voice issue. I remember quality of voice is given by tensor muscles. The main tensor is cricothyroid, and that is supplied by external branch of superior laryngeal nerve. And thyroid surgery can damage superior laryngeal nerve. Beta. The answer to this question is D, beta, my dear friend. D. Am I clear? D is the answer, beta. Okay, fine. Fine. D is the answer. Suhani, 19-year-old college girl, has presented to emergency with sudden loss of voice. Beta. Oh, young lady with sudden loss of voice. The answer is functional aphonia or hysterical aphonia. Absolutely, beta. Young lady, college-going girl with a sudden loss of voice. Sudden loss of voice is 100% functional aphonia, also called as hysterical aphonia. 20-year-old female is having sudden loss of voice. Okay, it's functional aphonia or hysterical aphonia. Important point is the cough sound is normal, beta. The second MCA question is, how would you prove that it is a functional patient? Means patient is lying to you. Patient has no problem. Patient is acting of voice problem. The basic thing is cough is normal, beta. Functional aphonia or hysterical aphonia, beta. Okay, okay, fine. Now, 3-year-old child has been brought to pediatric emergency with history of fever, respiratory difficulties, stridor, drooling of saliva since yesterday. 3-year-old child, beta. Now, answer is the diagnosis is acute epiglottitis. Acute epiglottitis, beta. Child is in a very critical situation with SpO2 level 80%, hypoxia. Okay, whenever there is a hypoxia, airway problem, don't think of X-ray, don't think of antibiotic, don't think of anything. Think of urgent intubation, matlab airway management. Airway. This is the type of question asked in pediatrics also, ENT also, medicine also, surgery also. Whenever the life of the patient is at risk, don't think of X-ray or antibiotic. Beta. First of all, airway. Airway is the main thing by intubation. Beta. It's a baby of acute epiglottitis, 2 to 7 years of age. Thumb sign is there, and the very common confusion now is that what is the most common organism to cause acute epiglottitis is, again I will say, it is Streptococcus pyogenes. I have checked with multiple people from PJ Chandigarh, from pediatric people, from microbiology people. The question never says in India, in developing country, in developed country. Question generally is about the world statistics, beta. HIV immunization has brought the HIV very down, beta. So, if you have any question, I know there are a lot of things on the internet, I know that. But most common qualitative organism, in consultation with a lot of pediatricians and microbiologists from PJ Chandigarh even, the standard answer is Streptococcus pneumoniae because HIV immunization has come down now. HIV infection has come down. Okay, fine. Fine. Chalo. Okay, fine. Next one. 55-year-old woman has been suffering from COPD. Faltu kahani, beta. They'll keep writing kahani. Neuromuscular respiratory insufficiency. 1 week back, she went when tracheostomy was done, beta. But the main thing is, in the morning round, you find that tracheostomy tube is blocked, beta. When you read a tracheostomy tube is blocked now, this turns irrelevant, beta. Try to see how we do the question. Blocked tracheostomy tube, SpO2 72%, very severe situation, airway emergency. What you should do? Remove the tube immediately, beta. I hope remember, when the tube is blocked, do not give oxygen, do not try to suction the tube, do not do anything, remove the tube immediately and put a new tube, beta. Oh, okay, but don't get scared of these long statements. Oh, tube is blocked, what would you do? I know. Rest of statement of the question is useless, beta. Okay. 20-year-old male patient has high-pitched voice. Oh, male with high-pitched voice is puberphonia. What is the name of maneuver of puberphonia, beta? Speech therapy given, Gutsman maneuver, beta. Remember, Gutsman maneuver, beta. Gutsman maneuver. Puberphonia is Gutsman maneuver, my dear friends. Gutsman maneuver. Very good. Fine. Now, everybody see the question. Mother has brought her 7-month-old baby to ENT clinic. Everybody read the question with me. Mother has brought a 7-month-old baby to clinic. She says that noisy breathing which gets better in prone position. The mother says that she noticed the problem few days after birth. The sound of cry is normal. What is the possible diagnosis, beta? This is laryngomalacia, beta. Laryngomalacia is typical. Laryngomalacia has got cry normal, beta. Laryngomalacia has got the feature of stridor, beta, stridor. What are 4 points of stridor, beta? Stridor is inspiratory, Stridor is since birth. Stridor increases on crying. Stridor is less in prone position. Stridor is inspiratory. It is since birth. It increases on crying, decreases in the prone position. And the treatment of laryngomalacia is a conservative treatment. No treatment required. Conservative treatment. Conservative treatment. Okay, fine, beta. Which of the following cannot be seen on indirect laryngoscopy is MCQ of the MCI, beta. Anterior commissure cannot be seen on indirect laryngoscopy. Indirect laryngoscopy, anterior commissure cannot be seen, beta. Look at me, beta. Anterior commissure is the anterior edge of the vocal cord. It is covered by epiglottis, beta. Laryngoscopy indirect is done with the mirror. Where is the mirror? On the roof right now. So you cannot see this anterior commissure. It is hidden by the epiglottis. You cannot see the laryngeal surface of the epiglottis. Okay, this surface. Laryngeal is the down surface, under surface. You can't see the undersurface of the vocal cord also. Beta. Okay, fine. Let us revise. What are structures not seen on IL? Number 1, anterior commissure of vocal cord. Number 2, laryngeal surface or undersurface of the epiglottis. Number 3, undersurface of the vocal cord and adjoining area of the subglottis. Number 5, ventricle and saccule. And lastly, apex of piriform sinus. What structure not seen? Please remember anterior commissure. Number 1. Number 2, laryngeal surface or undersurface of the epiglottis. Number 3, undersurface of the vocal cord and adjoining area of subglottis. Ventricle, saccular, hidden areas anyway. And last is apex of piriform sinus. Don't forget the anterior commissure. Old MCA question. Beta. A classical singer has presented with the history of hoarse voice. The picture is given over here. Please look at this. This is a case of vocal nodule, also called as singer's nodule, which are always bilateral and seen at the junction of anterior 1/3 and posterior 2/3. What is the treatment of vocal nodules? Voice rest or speech therapy? I will never mark surgery for a vocal nodule, beta. Okay, voice rest or speech therapy, beta. Okay, fine? Fine. Now, carcinoma larynx patient presents with the stridor and respiratory difficulty. Okay, cancer larynx patient has got difficulty in breathing, comes to emergency. What is the best level of tracheostomy in this patient? I hope remember, cancer larynx patient goes for high tracheostomy, beta. High tracheostomy is done at first and second tracheal ring. First and second tracheal ring, beta. Guys, this is the answer, first and second tracheal ring. Please do not mark A, beta, in a hurry. First and second cervical vertebra. Wrong, it's not vertebra. Are you doing tracheostomy in the vertebra? No, but they will give such choices to you, beta. So this is type A question. Oh, high tracheostomy is done for cancer larynx. It is done first and second tracheal ring. C choice, beta. C is the correct choice, beta. Okay. I will not do silly mistake. Remember the story of girlfriend and somebody going like that. I will not waste my energy here. I'll waste my energy. Oh, first and second cervical vertebra. No. First and second tracheal ring. C is the answer. This kind of thing will keep us on the other side of 150, beta. Believe me. Less silly mistake, beta. Young lady with follicular carcinoma thyroid gland underwent thyroidectomy. Total thyroidectomy, beta. Now her both RLN got damaged. Oh, thyroid gland. You remember thyroid gland surgery? Both RLN got damaged, beta. Okay? One U cut, one I cut. What procedure would be needed in this case? But people forget one word. Immediately. Immediately, beta. They will say lateralization of vocal cord. Because this is a case of bilateral abductor palsy. And they will jump and answer, oh, I know this question. I'll say, oh no, but that's not the answer, beta. Immediately you need tracheostomy. Why? This bilateral abductor palsy, look at my hand, beta. The cord are closed. Patient got respiratory distress, beta. The immediate treatment is tracheostomy. Try to recall your note. Don't forget this word, immediately. Immediate treatment is tracheostomy, but later on treatment after 6 months is type 2 thyroplasty or lateralization of vocal cord, beta. So this is a case of bilateral abductor palsy. See, a lot of people have said A. Don't worry. Let us do the mistakes now, but let us not do the mistake in the exam day. I will not skip the word immediately. Immediate is tracheostomy because patient got difficulty in breathing. After 6 months is type 2 thyroplasty or lateralization of vocal cord, beta. Let us quickly revise the thyroplasties, beta. Type 1, medialization done in adductor palsy. Type 2, lateralization done in abductor palsy. Type 1 and type 2 are opposite of each other. Type 1, medialization done for adductor palsy. Type 2, lateralization done for abductor palsy. Type 3, shortening, loosening done for pubalphonia. And type 4, lengthening, tightening done for androphonia. Type 1 and type 2 are opposite, and type 3 and type 4 are opposite of each other, beta. Am I clear, beta? Fine. So, type 1, type 2, beta. Once again, type 1, medialization. Type 2, lateralization. Type 3, shortening, loosening. Type 4, lengthening, tightening. Type 1 is done for adductor palsy. Type 2 done for abductor palsy. Type 3 for pubalphonia. Type 4 for androphonia, my dear friends. What is the correct site of implantation of the brainstem, beta? Implant. Yes, Brainstem implant is placed in the lateral recess of fourth ventricle. Auditory brainstem implant is placed in the lateral recess of fourth ventricle. And cochlear implant is placed in the scala tympani of cochlea. Two implant of ENT here. Cochlear implant goes into scala tympani of cochlea, but brainstem implant goes into lateral recess of fourth ventricle. Calorie test done on left side with cold water. Left side with cold water will produce nystagmus towards cold opposite warm same. Remember COWS. Left side with cold water will give nystagmus to right side. Okay, fine. Never do such. This you know cows, cows. Cold opposite. Left side with cold water, nystagmus to the right side. Okay, fine, fine. Left side with warm water, nystagmus to the left side. Okay, cold opposite, warm same. Very good. All are true for BPPV except I told you BPPV has got no other symptom, only vertigo. There is no symptom of hearing loss in Tinnitus. Remember, BPPV is a vertigo for few seconds on changing head position. Diagnostic test Dixon-Pike maneuver. Applis is the treatment. It is caused by displacement of otoconia or otolith, and most commonly they go to which canal? Posterior semicircular canal. Most commonly they go to which canal? Posterior semicircular canal. Guys, don't forget false negative Rene. Again a possible question. False negative Rene is a feature of unilateral severe SNH. False negative Rene is a feature of unilateral severe SNH, dead inner ear. If the question says dead inner ear, what type of Rene expected? False negative Rene is a feature of unilateral severe SNH. Okay. Now, guys, quickly with me, everybody, quickly, everyone, let us do certain quickly clinical vignettes. Clinical vignettes, everybody. 28-year-old female patient with gradually progressive hearing loss. 28-year-old female patient with bilateral gradually progressive conjunctive hearing loss is what? Otosclerosis, my dear friend. Let us quickly revise the clinical stories of ENT for FMG paper. Young lady with bilateral gradually progressive conjunctive hearing loss is otosclerosis, my dear friends. Now, 45-year-old female with pulsatile tinnitus or bleeding mass in the ear. Any lady, any female with something pulsating in the ear or bleeding in the ear is glomus question, rising sun sign. Okay, rising sun sign. Vascular tumor. Young boy with nasal mass epistaxis is angiofibroma. Don't forget, 12-year-old boy with nasal mass and profuse epistaxis is angiofibroma, and we will not get confused. Angiofibroma is also called juvenile nasopharyngeal angiofibroma. It's one and the same thing. Juvenile nasopharyngeal angiofibroma. Am I clear? Long-standing history of foul-smelling, blood-stained ear discharge. Long-standing history of foul-smelling, blood-stained ear discharge. This will be seen in unsafe CSOM. Whenever you read history, the foul-smelling, blood-stained ear discharge, it is unsafe CSOM. Unsafe CSOM. This needs charging. This one. Okay. Now 7-year-old with unilateral foul-smelling nasal discharge and epistaxis. Unilateral, single-side smell, single-side smell, single-side blood, single-side pus is foreign body in the nose, my dear friend. It is foreign body in the nose. Foreign body in the nose. My dear friends, it's foreign body in the nose. Okay, fine. Am I clear? Young 7-year-old child means school-age child with single-side smell, single-side pus and single-side discharge is coming over there. That is foreign body in the nose. Very important question. Now, 6-year-old child with chronic hoarseness of voice with mild respiratory difficulty. 6-year-old child with chronic hoarseness of voice with mild respiratory difficulty is a juvenile papilloma of larynx. Once again, juvenile papilloma of larynx, my dear friends. 6-year-old child with chronic hoarseness of voice with mild respiratory difficulty is juvenile papilloma larynx. Juvenile means 4 to 6 years. Papilloma is caused by human papillomavirus 6 and 11. Okay, fine. 6-year-old child, juvenile. Chronic hoarseness since birth problem. And respiratory difficulty means papilloma have actually blocked the larynx actually. 40-year-old female with brief episode of vertigo on changing head position. Brief episode of vertigo on changing head position is BPPV beta. BPPV. I hope somebody asked me also. BPPV is more common in females. Yes, more common in females. And it is for few seconds on changing head position. BPPV, my dear friends. Young patient with nasal crusting and roomy cavity is atrophic rhinitis. Roomy nasal cavity, crusting, atrophic rhinitis. But same question, beta. Same question. Young patient with the cavity, roomy cavity, crusting and hard external nose. The answer will change to rhinostroma or woody nose, my dear friend. Rhinostroma or woody nose. Okay, fine. Fine. Russell body, Miculicel, tetracycline septomycin are drug of choice, beta. Okay, fine. Cochlear implant, visual question, beta. What are the 4 parts of cochlear implant, beta? External component. Let's quickly see, beta. Number 1 is microphone. Number 2, speech processor. Number 3 is your visual question, beta. Number 3 is important. And number 3 is transmitter. Transmitter is a visual question, beta. Transmitter. Okay? Fine. Now, next one. Stapes piston prosthesis. Anything like a question mark is a stapes piston prosthesis, and this is used for otosclerosis surgery, beta. Stapes piston prosthesis, it looks like a question mark. Anything like a question mark is stapes piston prosthesis, beta. Visual question, beta. Normal tympanic membrane, red tympanic membrane, AS to M. And this sign is called cartwheel sign because there are multiple capillaries which are dilated, visible on tympanic membrane, beta. Cartwheel sign is a feature of acute suppurative otitis media, beta. Glue ear, remember the glue behind tympanic membrane with air bubbles over there, beta. Just keep the picture in mind, glue ear, okay, fine, very good. Grommet is like a dumbbell, beta. Grommet is like a dumbbell, my dear friend, okay, it's a very small one. Grommet is for glue ear. I remember G for grommet, G for glue ear. Keep the impression in your mind, beta. Grommet, okay, fine. So this is the grommet look like. Any white ring-like thing in your tympanic membrane will be a grommet, beta. Grommet. Grommet is used for glue ear, also called serous otitis media. Cauliflower ear or boxer ear, it is due to trauma of the, pinna. There is a hemorrhage, there is a hematoma of the pinna, and that leads to necrosis of cartilage, and that is called boxer ear or cauliflower ear, and this is post-traumatic deformity of the pinna. Okay, fine. Darwin tubercle is not a disease, it's anatomical variation. It's a conical elevation on helix. Darwin tubercle is not a disease, it's anatomical variation, it's a conical elevation on helix. Bat ear is absent anti-helix, beta. There is no anti-helix. This is, beta, look at screen, beta, everyone. This is helix and this is anti-helix. This child has no anti-helix, beta. The absence of anti-helix is called bat ear, and the surgery is done at the age of 6 years, beta. 6 years or after that. Why? 6 years or after that, beta. The surgery is done at 6 years or after that. Okay. Seagull speculum. How to identify? It will have a, magnifying glass, beta. Signifying. How to see? It has a magnifying glass and other side bulb, beta. Bulb. Okay, bulb, beta. Okay, fine. Magnifying glass or bulb, beta, over there. Okay, fine. Seagull speculum. Can you use it for foreign body removal? Never. It puts the pressure on your ear. Why would you use it in foreign body? Never. Seagull speculum has got no use for foreign body removal, beta. Okay, it has got a magnifying glass over there for sure. What is the name of this maneuver? Dick-Stolberg maneuver has got 2 positions. Sitting position, lying down position. But Apple's maneuver has got 5 positions. 5 positions from sitting to lying down to turn the head to turn the body and again sit down. Apple's maneuver is a treatment of BPPV, my dear friends. Okay. This is what Bara, beta. Bara. What is the most important wave of Bara is wave 5, and wave 5 is produced by lateral lemniscus. Beta. Lateral lemniscus, my dear friends. Don't forget that the auditory pathways E. coli ma, beta. E. coli ma. Today also they have asked in INACT the correct sequence of the auditory pathway. Remember E. coli ma, E for 8 nerve, C for cochlear nucleus, O for olivary complex superior, L for lateral lemniscus, I for inferior colliculus, M for medial geniculate body, and A for auditory cortex. Beta. E. coli ma is a mnemonic of auditory pathway. Please revise that. Today it was asked in INACT paper also. Beta. Otosclerosis Carhart's notch, dip at 2000 Hz. Everybody ready? 2000 Hz. Okay, am I clear? Dip at 2000 Hz over here. Carhart's notch, otosclerosis, beta. And notch into the hearing loss, 4000 Hz dip at ACBC both, beta. Okay, my rhinophyma, potato nose, my dear friend. Don't forget this question. Potato nose, beta. Okay, visual question. Potato nose, beta. It is hypertrophy of sebaceous glands of the skin of the nose, beta. Okay, rhinosporidiosis is like a mulberry-like mass, beta. Strawberry mulberry-like mass. Tamil Nadu patient, it's rhinosporidiosis, beta. Okay, rhinostroma is woody nose, beta. Woody nose. That is typical history of atrophic rhinitis along with a hard nose, beta. Okay, woody nose. Result body, Macula cell are histopathological findings of rhinochroma, my dear friends. Basal cell carcinoma, rodent ulcer, visual question of your paper, beta. For derma also, beta. Please understand, any ulcerative lesion on nose or pinna, please mark basal cell carcinoma. Let me tell you a secret. Any ulcerative lesion on the nose or pinna over here, it's basal cell carcinoma or rodent ulcer, beta. Okay, visual question, beta. We know quinsy now, okay. Glottic web. Yes, one old question of the MCA paper. Most common site of laryngeal web is glottic web, in between the vocal cord. Most common site of glottic web is, most common site of laryngeal web is glottic web between the two vocal cord, and the cry will be hoarse in this patient. When the vocal cord have a problem, the cry has a problem. Ongular line we done, extra we done. Okay, please. At the end we see two mirrors. One is posterior rhinoscopic mirror is angulated mirror. Angulated mirror, but indirect laryngoscopic mirror is a straight mirror. Posterior rhinoscopic mirror is an angulated mirror, and indirect laryngoscopic mirror is a straight mirror. Okay, fine. Now, again a visual question of your paper. Lax tongue depressor. This is L-shaped. It is L-shaped. Lax tongue depressor, L-shaped this thing, and it's used for the oral cavity oropharyngeal examination. Okay. Maringotomy knife, it is used for the maringotomy. It's a for the ear surgery called maringotomy. Okay, fine. Okay. And lastly, Mollison's mastoid retractor. The complete name is Mollison's self-retaining mastoid retractor. Okay, fine. Mollison's self-retaining mastoid retractor. Okay, fine. Now, at the end, guys, give me 2 more minutes and then I wind up. This was just my attempt to make you visually go through the couple of things which you already know, I know, but only to make sure that high yield things should be revised together in the form of question and visual and all that. You will get the questions question PDF with you maybe tomorrow or something. You solve those questions and just get confident, and that's all about ENT, beta. Don't really spend too much time on ENT. Now let me go beyond ENT for some time, beta. Just give me some time now. Now, first of all, we are at 8th of May, and approximately we're saying that there are 20 more days, and then the last week starts, beta. Till 27th May, everybody, please create a very cut-off line in your mind. Till 27th May, you are accessible to other people, you are talking to other people, you are doing this YouTube, that YouTube, whatever. But after 27th May, the last 1 week belongs to your own revision. And may I remind you, 28th May is first year subject, 29th May is second year subject, pathology, microbiology, pharmacology. And then 28, 29, then 30th belongs to the 28, 29, 30. 30th belongs to the third year subject now. Please understand, you have to do the IE, ENT properly, beta. Like PSM has to be given a half day properly, then forensic also has to be done on that day. So please devise your own plan how to really go after 27th May, 28, 29, 30th, 1st, 2nd, and 3rd. 31st and 1st, you should really be doing the final year subjects, beta. 31st is for the, you can say, surgery, ortho, please do that, and then do radiology revision on that day. First you make medicine plan, pediatric plan, and derma, psychiatry along with that, beta. And second, you have to see all the T&D paper, and you have to do, last year question also wherever you have them. And the third, you do the staging systems, images, PSM data, and last of the day, the second part of the day, revise whatever subject is your favorite. That's not a problem. But the most important thing is, please keep the hope alive, beta. Last part of the preparation is always the toughest part of preparation, and we start getting the maximum doubts in the last part, beta. Last part of the preparation, we start feeling, will I make it? Will I pass this time or not? Last time I could not pass. What will happen? Guys, let us do some mental, conditioning over here. I will see whatever happen, but I will not waste a single day, beta. That single day amount to one subject sometime, beta. If you waste a single day thinking what will happen, rather than that, why can't you invest a single day to revise whole of psychiatry and whole of anesthesia? I have a question to all of you. You want to invest single day in psychiatry and anesthesia, or you want to keep predicting your failure, and in that negative thought, you want to waste one more day, beta. That's not the right approach. Whatever will happen, nobody knows. I wish I could have the decision to make you pass. I would have passed every FMG by now. That's not a problem. But nobody can predict what will happen on the exam day. But we can put our best foot forward for sure, beta. Guys, stick to this positive thought within your mind that I know I'm a modest person. I know I'm a moderately okay person. I know I'm a super duper knowledgeable person. I'm not that. But I think I have got a lot of data in my mind now, which I have revised in last couple of days. I know still I have doubts. I know I still get stuck between two choices. A lot of time my two choices still going wrong, but I have got now time of these 20 days, and then last 1 week, I think if I really move systematically in these 20 days and then last 1 week, I would be able to see a lot of data 2 more time. And I think with that practice, last day I will have less number of confusion between choice C and D and A and B. Beta. Okay, my heartfelt prayers for all of you. Beta. We'll stay connected. We'll again meet close to 27th May for sure, and we'll be together till your exam is over and after that too. And I'll just request one thing to you, all of you, beta. Maintain this, the positivity in your heart, and maintain this, rhythm of preparation every day intact. Don't waste single day. A single day may be too short a date for you, beta. Just maintain that. Whatever result will happen, forget that, beta. Just leave it to Almighty to decide. I am going to put my best show on that day, beta. Okay, guys. Thank you very much. God bless you. We'll stay connected further. Keep learning, keep revising. You're going to make it. Just remember that. Thanks a lot.